So one of the things we are doing in the PSS side, as well as CFSU as a whole, is updating the welcome book. A lot of you, I'm sure, are very aware that the welcome book is quite out of date. Apologies for that, but we want to hear from you. We can't update the new processes and everything else because sometimes we just don't know. We obviously know the military policies, processes, but when you cross the border, the import issues, all that kind of stuff, we don't know that unless you guys bring that to us. So my section wants to do a think tank with new members, spouses, families, to just hear from you what the issues were and how we can best support you going forward. So if there's anyone in this room or anyone you know that wants to be a part of that think tank, please just present yourself to me or Warrant Colbrick, or you're in the room here somewhere. Oh, she stepped out. But yes, just present yourself to us. Our contact info is there too. If you want to present yourself over email, just reach out to us. And without further ado, we will bring in the commander.
Hey, morning, everybody. Bonjour à tous. Thank you for coming to the welcome briefing today. They got a whole list of things for me to say, and I'm going to skip the speech and allow the team to say what they need to say, because I'm new as well. So I should be actually in these seats with you, but I don't have time to be here. So I apologize for that. I want to thank everybody for those of you who attended the barbecue on the weekend. The team did a really good job of organizing that, and then of course the Battle of Britain parade was very well done. The location here is excellent. I mean, the fact that they have that little spot dedicated to that sort of event is great. I suspect, I don't know, but I suspect our Remembrance Day is probably going to be in a similar venue. Yeah. But thanks very much for everybody being there. I've been here about 2 months. So like I said, I'm new, just like you, dealing with all the frustrating administration. I still haven't registered my cars. I don't actually know how to do that. But I'm trying to, put that off as long as I can. A bit of avoidance going on my part, but I think I'm going to have to deal with it at a certain point. So for those of you who've had to deal with that already, apologies. But I'll tell you, when I went to the UK, I was in the UK twice, and I think you quickly realize that, or you're quickly, if it's your first time OUTCAN, you're frustrated by all the differences between here and Canada. But of course, anybody who's moved between our provinces has seen that there's some significant administrative details or differences between our provinces even. But I tell you, going to the UK with very similar challenges, but then coming home to Canada, that was almost, if not worse. It was almost as bad, if not worse, coming home to Canada. The sort of things they required and the sort of paperwork that I had to chase around looking for. And I tell you, coming to the States so far at the border, you know how in our CFSU book, they tell you all the paperwork you have to be prepared? Well, I was prepared. I had a stack, and the guy basically waved me through, And that was even with a second vehicle behind and 3 cats and my little explanation, oh yeah, you can both go through, enter our country. He didn't even want to give me a stamp. I had to force him to let me go in and get a stamp, which then the stamp was pretty non-specific. So the value, questionable value, I think, the stamp that I've got on my passport that tells me I'm allowed to be in the States. But anyways, all that to say, once you get through that administrative headache, you're going to enjoy being here in Colorado Springs. I know that there's some trepidation potentially, particularly on the part of the spouses, about coming down to the States under the current political dynamic, but I'd suggest to you that our hosts and our American colleagues are gracious, they're generous, and they see the same issues or they have the same issues with the political dynamic as we do. So I think we just need to put that to the side, live our lives, and be great teammates here in Colorado. And I very much have experienced, and I think it'll continue, that the Americans will be very welcoming, and they'll embrace us as part of their own. And we always, when we're OUTCAN, to a great extent, you're handpicked by your trades and by your services, and you punch above your weight, and they know that. So I don't see that changing, despite the things that we hear coming from Washington and Ottawa to a certain extent. I'm not going to steal the thunder of the team, of course, in terms of all the things that you're going to hear about today. They all sound pretty interesting. I too am suffering the huge delay in getting employment authorization documents for my son's quite frustrated. I think we're at least 5 or 6 weeks down track. My wife got hers though after only 3 or 4 weeks. So I don't know what the difference is. I might look into that if it goes on for much longer, but we're certainly suffering that. And CFSU, they're here to help us with their expertise and their focus on getting through all these things. So don't be a stranger. Make sure you reach out to the team. They're here for us and for you. Merci encore d'être ici aujourd'hui avec nous. Je suis sûr que l'équipe va être capable de répondre aux questions en français, si nécessaire. Principalement ici aux États-Unis, on parle anglais, mais on doit toujours être conscient des francophones qui sont ici avec nous et nous sommes tous capables de parler et d'expliquer les choses, les aspects différents et difficiles ici aux États-Unis. Whether you're posted here at CFSU, you're part of Building 2, or some other organization that I have yet to become aware of in Colorado, thanks very much. We have an incredibly important job to do here, made even more important and critical based on the recent change in focus in terms of both our governments focused very much on continental defense, which as military professionals and spouses supporting those military professionals, we all know is incredibly important and has been under supported and not sufficiently focused upon over the past number of years. So we're the benefits of this shift in political focus and the incredible investment that Canada is putting into the Canadian Armed Forces, with a particular focus on the North and a particular focus on continental defense. And the fact that we're here in the US doesn't mean that we're not part of that. We're actually leading the discussions where improving our defense of Canada and the defense of the continent are concerned. So NORAD, just to be clear, NORAD is a Canadian headquarters, despite the fact that we're here in Colorado Springs. I wouldn't be the deputy commander of this command if it wasn't. So we have to push that message to Canada. Every Canadian that's down in the States as part of the NORAD enterprise is actually part of a Canadian headquarters. We're the force employers for airspace warning and airspace control. We're the beneficiaries of maritime warning, but we are the air defenders of this continent and on behalf of our country. Don't forget that. We are OUTCAN, but we're not really OUTCAN. This is a Canadian headquarters. And I'll leave you with that. And Chief, I think you have some words of wisdom as well to share.
Not sure about wisdom, but like the boss, I'm also new and suffering the challenges. I managed to get my VIN verification done, so I'm one step further. All right, so just a quick words to build on what the commander shared, that the formation, we're more than just a formation. We're a family, and we work together, we support each other, and we take pride in being part of a community that looks after their own. So that includes our families. So the commander, myself, the CFSU team, and the MFS, we're here to support our members, but also the loved ones that stand behind them. So if you need help, you need guidance, you need someone to talk to, you're unsure about something, please reach out. We're here to help. Merci à tous d'être ici. Ensemble, on va travailler fort pour renforcer la communauté en misant sur la confiance, le respect, le soutien mutuel. Bienvenue dans la famille. C'est un plaisir pour être ici avec vous aujourd'hui. So welcome to the family. We look forward to working with you, getting to know you all. Thank you. Merci.
If you figure out anything I need, let me know. Have a great day.
Hi, good morning to all. It's Major Darren Martin. I'm just
You all set
waiting to
there, Major
see-
Martin?
Yeah, I can see my slide up on your side. So I think we are good to go. Yes, so thank you to all that are both online and in person there in Colorado Springs. I do apologize. I think maybe next year we will figure out a way to bring myself and my team out there in person for Colorado Springs. We enjoyed our time there last year, so we'd love to come back and be there to support. For those that I have met or haven't, I'm Major Jaron Martin. I'm the Canadian Forces Medical Liaison Officer. Online with me, I have Captain Rook and Master Corporal Ramkishore. I will apologize. I am unilingual, but I do have two bilingual people who can help me with any questions en français. So please feel free to put those out there. So we're going to go through who we are and what we do so that you guys know how to get help when you're accessing healthcare, because healthcare in the US is not as easy as back in Canada, like full stop. In the room, you're going to hear also from the TRICARE operations staff from Colorado. For those online, this is something we're adding on. And if this is something that you think would benefit you, we know all of these people at all of your bases. And so we can set these up for the DET COs and things like that after the fact to bring these people into your unit lines and help you get these individual contacts. But we'll go through basically how you get care, what you're entitled to, what you're not entitled to, how you access it, and how your families are going to access care. We'll run a little bit through the administration requirements that are specific for CAF people, because we still have duties to report and medical employment limitations and aircrew medicals and things like that. And then we'll get into some dependent specific things. I'm aware that Taylor gave me a compressed timeline this year, ironically with a longer or a shorter presentation. I had more time last year, but I'm going to stay online through the TRICARE operations, and hopefully if there's any questions, we'll have some time at the end. So my boss is Commander Ian Beck. He's the Canadian Forces Health Services Senior Advisor. So he is the representative of the Surgeon General down here in the US. He's working on strategic level CAN-US partnerships, working directly within the Defense Health Headquarters down here and partnering with defense universities and NATO and all these other strategic organizations. So on a day-to-day basis, most of you probably won't see Commander Beck. The only reason why I put it up there is because when I'm on leave, he is the other doctor that's down here. So he is available for support, advice, authorizations, anything like that. My role down here is sort of three-hatted. First hat is that I am your clinician. So I'm your Canadian Forces medical officer. You can ask me medical questions. I can give you medical answers. I can help guide you through the medical system. I can go through what the US are doing with you and talk to you about your problems and make sure that you have the appropriate medical limitations for your job. That's my first hat. My second hat is that I'm the medical advisors to the chain of command. I'm basically the base wing surgeon would be back in Canada. So if you're a chain of command and you're wondering, how do I employ a member? I have a member who has something going on. What do I do about it? Then you're going to come to me. That goes all the way up to the commander, as well as the CDA here for CDLS Washington. And then my third role is that I serve as the go-between between us and the Department of Defense for any healthcare access issues, healthcare access, contracts, things like that. I myself and my team are the lead on that. So we work to make sure that you guys can get access to care. Captain Tegan Rook is our new staff officer, health administration. So she just came in and she's living your reality here in Washington of registering vehicles and things like that. But she's the SME and becoming fast the SME on all of the policy, insurance policy, TRICARE. She actually just did her TRICARE operations course so that she's becoming more and more knowledgeable on what she can do and how we navigate the healthcare system down here. So sometimes you may send a question my way. I'm going to send it to Captain Rook if it has something to do with contracts. She's also the one that has all the authority to authorize funds on behalf of the Crown for healthcare down here. Master Corporal Ramkishore is my medic down here. He's our medical coordinator. he's basically me and Captain Rook rolled into one person with all of the responsibilities as a Master Corporal. So he answers medical questions, he answers administration questions. He's a great first point of contact for anyone that's having any issues. He works closely with all of the MTFs and basically knows every person that can help you almost on a first name basis. And he does a lot of effective triage of issues that come in, and then sends them off to Captain Rook or myself, depending on if it's outside of his wheelhouse to control. And the last person that you'll need to know on the team is Miss Natalia Pella. She's our med records clerk. So putting things into your medical record or having to get things out of your medical record, she's going to be your contact for that. She also takes the lead on all of our screenings internally down here in the US. So she's my screening coordinator. So if you're ever going to be extended or cross-posted, you're going to work closely with Natalia to get all the medical things done with that. So that's the team. Most of you having just arrived are probably wondering, well, how do we get started? So let's start with registration. So when we register for DoD benefits, the first thing you're going to do is go to the DEERS office to get your CAC card, or depending on your position, you might just get a next gen ID, which looks somewhat like the screen there. When you go, you're going to have a sponsor letter. That's your DD form 1172. You're going to have to bring your passports, marriage licenses, birth certificates, your posting message. And then you're going to go in and they're going to put you administratively into the US system. This is not a medical process. This is an administrative process. The key part here is that this serves the backbone from everything else from there. So if you can remember two things, one is that make sure that your address is right, because we've had DEERS places put in the wrong addresses. So like double check all of the information they're putting into their system. And then the second part is that what you need to make sure is that you get the correct healthcare delivery program codes. So these healthcare delivery program codes for CAF members that are sponsored by the DoD are going to be 011. For all of your dependents, including a service spouse, is going to be 012. Your card's going to say foreign military, and if this works, it should say foreign affiliate military. And you should see here, authorized patronage, MWR, commissary, unlimited exchange. And then if you look on the back, it's going to say outpatient direct care at no charge, inpatient direct care on a fully reimbursable basis. That's not actually our entitlements, but that's how you know you have the right code. On your spouse's card, it should say spouse, foreign military affiliate, same thing. You should be allowed to go to the commissary. And then it should say outpatient direct care at no charge, inpatient direct care on a fully reimbursable basis, outpatient civilian care on a fully reimbursable basis. We're going to talk about all that, but just it's a quick look to say, hey, when you get your card, if it doesn't say those things, something's wrong in DEERS. And if something's wrong in DEERS, then we're going to have a problem as we go down the line. Because what happens is that TRICARE pulls its information from DEERS. And so we got to make sure that's right. And at the end of that, what you're going to do is you're going to get a foreign identification number, and you're going to have to write that down because it's the only time you're going to be given it. Okay. And then so the next question from that is, what is TRICARE? So TRICARE is the healthcare program for the U.S. Department of Defense. It has two arms. One is direct care. So that's care that is given in a military treatment facility, an MTF. Okay. And then it has private sector care. Private sector care is insurance providers that have signed on to be network within the TRICARE network to provide care at a certain cost. Okay. When we get registered for CAF members as TRICARE Prime type plan benefits. We are not enrolled in TRICARE. Sometimes you will go to DEERS and they'll tell you, okay, call TRICARE to complete your enrollment. We do not have to do that because foreign members cannot get enrolled in TRICARE. Only US service members can. What happens is that this basically gets mirrored onto our account. So CAF members will have TRICARE Prime type. CAF dependents will have TRICARE Select Group B type plan benefits. The only reason why that's useful is if you ever want to look on their website to say, hey, what are my benefits? What am I able to get? You can select your correct type. But what this looks like more reasonably is this. Back home, CAF members get care in the military system. It's driven by the QRNOs and Blue Cross. Dependents are used to getting care. Our family members are used to getting care in the provincial system with public service healthcare plan and the public service dental care plan. Okay, we're used to knowing that those two circles are separate and they never really cross. Here, what happens is TRICARE gets dropped in the middle of it. And TRICARE then becomes our primary way that we get healthcare. It has a schedule of benefits of what is covered and what is not covered. And there's things that exist outside of TRICARE. So for CAF members, that might be things like glasses. So you may need to get your glasses still through Blue Cross. Those are still covered while you're OUTCAN US. For our dependents, it may be things like our co-pays and our cost shares, and those are going to be covered by the public service healthcare plan. Now, if there's something that's not covered under TRICARE and not covered under the spectrum of care, like say cosmetic surgery, it's not going to be covered in the US. If there's something that's covered by TRICARE but not covered by the Blue Cross, say LASIK surgery, that's still covered by TRICARE, so you can still access those services. So it begins to blend together a little bit, and we use this chart, which is a very confusing chart, to sort of know how we get care. And the reason why I show this is that there's just slight difference for us, is that some people live in what's called a reciprocal healthcare agreement state. There's 7 states that the US DoD has decided to give us full coverage for everything from inpatient care to outpatient care in their military treatment facilities. Unfortunately, Colorado is not one of those states, but if you're up in JBLM in Washington, or you're over in, maybe you got a great post over in Hawaii, I don't know who's all online, or Texas, then in those cases, if you get admitted to a military treatment facility, you're going to be covered. Okay. However, in Colorado, if you get admitted to a military treatment facility, eventually they're going to ask for a bill. Now, that bill is still covered. If you're a military member, you're covered under Blue Cross. If you're a family member, you're covered by the public service healthcare plan. But the DoD is not going to cover that care. If we are ever admitted into a civilian hospital, that's never covered, no matter where you live. That's going to end up under Blue Cross or the public service healthcare plan. But as long as you get referred, you can go see civilian doctors in the outpatient community. Now, we know that there's current issues going on, and I'll talk about how we troubleshoot that a little since the TriWest takeover. And that brings me to the fact that we exist in 2 TRICARE regional contractors. So TRICARE is the big provider. If you live in this big blue area, you belong to TriWest. So that's going to be anyone really outside of Canada at Tyndall and Canada at Tinker. However, if you're in those debts, then you're going to be under Humana. These are people who administer the plan. The only reason why I bring this up is TriWest is new, and we've had a lot of issues with foreign approvals. So we work on, we are working on those actively, but you may encounter some of these roadblocks, and I'll go through some troubleshooting maneuvers. So whenever we're accessing services, the best way to access services is what's called direct care, and direct care is on a military treatment facility. So it's available to CAF and dependents at no cost. Whenever you walk into a military treatment facility, you will never have to pay the military treatment facility anything. There's some bases that don't allow family members in their clinics because their clinics are understaffed and need to support the service members. For example, that's the case in Tyndall Air Force Base. If that's the case, then if they don't see American family members, they won't see Canadian family members. If they do see American family members, they will see Canadian family members. You can go there for most services, and many of their places have an inpatient ER, specialists, things like that. To schedule appointments, most clinics will have a centralized local appointment line, and when you register for the services, they should go through how to book a clinic. The other part is MHS Genesis, which is their electronic record. You can access a portal, and there's login and portal creation instructions online. Or if you're having trouble, you can reach out to our team and we'll help you, and then you can use online scheduling to make appointments. One of the key things, though, that I always want to point out is that as foreign members, we do not get assigned a primary care manager, which is the equivalent of a family doc. Because of that, sometimes when we phone to book an appointment, you're going to hear, oh, you don't have a PCM. you just have to know that this is the fact, and you go, sorry, no, I'm a foreign active duty service member, or I'm a foreign active duty family member. We don't get assigned to PCM, but I am assigned to your clinic. Please book me an appointment. Then if you're still getting issues with booking an appointment with a PCM, make sure you let us know, because we'll reach out to those clinics and educate. Because sometimes, there's some people who are one-of-one. Clinics aren't used to seeing a foreign member, so that we work to educate those individuals. Now, if you're ever referred out from primary care, you're going to end up in a referral pathway. And that referral pathway is going to look a little bit like this. You get a clinical referral because of a medical need. The first thing you have to get is an approval from Humana in the East or TriWest in the West. They verify that you're entitled. Sometimes they'll come back and say, you're not entitled, you're foreign. At that point, we have an issue with education. We're going to engage some services, and you can reach out to us. Most commonly, though, you're going to reach out to what's called your BCAC, or your Beneficiary Coordination Assistance Counselors, and they're going to help you navigate that referral issue. Okay. Once you get the referral, they're going to tell you who you can book your appointment with, and you book your specialist appointment. The specialist will bill TRICARE. TRICARE will pay the specialist. Now, if you're a military member, it's always going to go down this pathway. If you are a family member and you have select group B type, you can actually book directly with a TRICARE network specialist without pre-approval. It's part of your suite of benefits. So if you just want to go see, say you saw a cardiologist back home and you need to go see a cardiologist, you can just go on the website, find a network cardiologist who's closest to you, contact them, give them your benefits ID, and book directly with them. Here I bring up network providers and non-network providers because these are new terms for Canadians. A network provider is basically someone who's agreed to take however much money TRICARE will give them for that appointment. They're not going to charge anything more to you as the patient. A non-network provider has not made that agreement. And if you go see a non-network provider, you can go see them, that's fine. But if there's a difference in how much money they want for the clinical visit and how much money TRICARE is willing to pay, they're going to pass that cost down to you as the patient. So we do recommend that you stay within the network, only because these are people who understand TRICARE's policies and will make sure that you don't get billed. So for coordination of benefits for our CAF members, and I'm going to go through this for dependents in a little bit, the US DoD is going to pay for any outpatient services in the military treatment facility, any off-base outpatient care if you're referred from the MTF, inpatient services in the MTF if you're in an RHCA state, and then prescriptions filled on base, even if they're written off base. If you go see a specialist and they write you a prescription, bring it back to base, it's going to be free. Okay. The CAF will reimburse you for any care under spectrum of care that's not covered by the DoD. So that's outpatient or inpatient. Unless it's an emergency, it requires pre-approval by myself, and that's usually done via email. It gets claimed through us. You send us the claim. We then work with CFSUCS to make sure it gets into your pay. If you are admitted, and you end up having what's called subsistence fees, which is basically your food and linens and things like that, we cover that, as well as any medically necessary travel greater than 100 kilometers. So if for some reason you have to go see a specialist and they're more than 100 kilometers away, by the rules, that's how much we'll cover. So the key point here is that if you're a CAF member, whether you're on leave without pay or SSEP, you're going to use TRICARE as a primary, and then CFL Services Debt Washington for Blue Cross as a secondary. Your dependents are all going to use TRICARE and then MSH International and Canada Life. So if you ever do need to get coverage by CAF Spectrum of Care, just here's a brief synopsis. I'm not going to belabor this, but it's basically, hey, most common one is glasses. Haven't had glasses for 2 years, I need glasses. You send me an email, it says, I haven't had glasses for 2 years, I need glasses, I have my eye exam done, I'm gonna go buy it. I go, okay, approved. And my typical timeline for that to turn around is within 1 business day. As soon as you have that written authorization, you can go and get your glasses, provide receipts and my authorization email, and then we reimburse you. We also make sure that you turn in your medical records. If you get admitted to hospital or you go see an emergency or anything like that, don't need pre-approval. Those are medical necessary treatments. You just go do it. Okay. But the other one this comes up with sometimes is a medication that's not covered by TRICARE, but is covered by us. And so if that's the case, then the same process. Hey, doc, I need my prescription refilled. I go, yeah, sounds good. You're approved. You can go fill it then at a civilian pharmacy and claim those costs. But that doesn't happen that often. Okay. In an emergency, get care. Number one, full stop. Do not do anything but get care. Call 911, go to the nearest emergency room. Don't worry about anything insurance or anything like that. Once you're there though, this is the only time where I do say call TRICARE. Give 1-800-TRICARE a call and just say, hey, this is me. Here's my DOD ID. I had to go to emergency, or my child had to go, or something like that, because then they can start to process an authorization in the background for emergency care. Then you can contact me after that. Once things have settled down, people can contact me and just say, hey, this is what happened. The only reason why is so that we're tracking, and say you do get admitted, we can start to put some administrative supports in the background to help you manage things like bills and anything that could come up after a medical visit. But with all of this, make sure you request your documentation. Your medical documentation you're going to want in your medical record, any receipts and anything like that you're going to need if you're going to be submitting claims. After everything is secured and everything's done, if there is an issue and the hospital is asking for bills or things like that, contact your local BCAC first. Your Beneficiary Counseling Assistance Coordinator at your MTF will be the best to handle an issue directly with the billing hospital. If we're not able to sort it out, then you can come to us, the CFL Services Debt Washington team. And then at any time though, through all of this, you can just, there's my office phone number. Give it a call, and I will always answer. Key tips, make sure you keep all your documentation. Dental support. So if you're on base, you have access to the MTF for routine dental. So that's your annual hygiene, your annual checkup. Some will do minor treatments, some won't. It is highly variable. Theoretically, they're supposed to refer out for minor treatments, but some dentists are just really good to us, okay? Speaks to what the commander was saying about the Americans wanting Canadians down there. However, if you do get referred out, you have to get that approved by the OUTCAN dentist, okay? So the OUTCAN dentist is right now Major Mary McDonald. You send her an email with the treatment plan and the estimate, and then she's the one that approves that. Dental emergencies are always covered as well. You crack a tooth, you have bad dental pain, go get seen. We'll sort it all out afterwards. If you're a spouse on SSEP or leave without pay, the military dental clinics will only see service members. They won't see family members. So in that case, you'll do your hygiene on the economy. We'll submit those claims through us, but same thing, anything past your normal hygiene and your normal annual has to get approved by Mary McDonald. Medical advances. So this is super important. So when to use. Anytime really you're having a lot of bills and you have to pay them. We'll do it at a minimum of $400. But basically you fill out 2 forms, you send that to us, we process it and approve it. It goes back to CFS-UCS and they'll put it in your account to pay, right? These are a medical advance on pay. So it does come from the Crown. So there's an expectation of repayment when you have finished your claims and you've been repaid by the insurance company. The expectation is within 6 months. That doesn't happen all the time, and that's okay. All we do is we provide an update that says, hey, we're still working with the insurance companies, that they'll get that. Once it's sorted, they're going to pay you back. They're fine with that. We don't put any of these into like collections on your pay or anything like that while we're waiting for an insurance company to sort itself out. Okay. If at any point you have questions about, hey, how do I get an advance, anything like that, you can contact us and we'll help you with that. Again, the priority is get medical care first. Medical care is expensive. The most expensive thing that someone might do down here is have a child. It's about $60,000 US. So when that happens, you're going to have to pay that bill. And I mean, if you have $60,000 US sitting around that you can just sort of hold off for 6 months or a year, we should be friends. Otherwise, let's lend you the money from the Crown and then we'll get it sorted out after. How to troubleshoot this when it all goes wrong. So this is a new slide because we've been sort of updating our briefs. So the first thing you should do if you ever have any problems with referrals, bills, anything like that, is contact your local BCAC. They are the SMEs in helping us, and you're going to hear from two of them there. Why not? They'll help with billing errors, coverage disputes, anything like that. The next step is to notify our team. Okay. And then the next step is that if you're notifying sort of Captain Rook and Captain Ramkishore and you're not getting a response, is to notify me. And I'll make sure that we're all on it as a team. It's rare that someone has to do that though, unless there's like a certain issue going on in our team here. If there is something like, hey, you get a thing for collections, notify us immediately. Okay. If it is a denial for something like a cancer treatment or a life-saving medication, notify us immediately. We have elevation steps that we can do that are outside the local area to help you sort these things out. Okay. But the biggest thing with all of this is that if we don't know what's going on, we have a hard time trying to help you manage it. So just keep us in the loop. We'd rather be told more of what's going on than less. A lot of people there will give you the US centric answer, which is call TriWest, call Humana, call TRICARE. Those are not a foreign answer. Our foreign answer is to go to the BCAC. If the BCAC can't fix the solution, to come to us, and we will work with the teams at Defense Health Agency to fix the solution. Okay. The last thing I'll say on this is that if you are ever told by a clinic, hey, we've checked your insurance, it's not valid, we're going to cancel your appointment, don't let them do that. Say, hey, don't cancel my appointment. Please contact your regional TRICARE rep. They should be able to help you. And then once they do that, after that point, contact us or your BCAC and just be like, hey, I just got told they're going to cancel my appointment. That way we can contact the provider. Because again, all of this is an education piece, because they know how to deal with US service members. They don't always know how to deal with Canadian service members. And you might say, hey, there's like 100 of us or 150 of us or 300 of us in the Colorado area. That's nothing to these providers. They see way more than that, and it's really hard for them to keep it all straight. So key point, don't ask for reimbursement if you haven't asked for the money beforehand. These are just sprinkled throughout. So medical administration. So starting this year, there's going to be something that comes out in October. Unless you are an active air crew, you will be required to do an annual medical information submission, as that is your annual APRV, which we are all required to do. So you will have to fill out this form and a health questionnaire and make sure you send in any US medical records that you have accrued over the past year. This is going to be done as part of our duty to report under QRNO 1918 and our annual APRV by the DAOD. This is going to replace the concept of a PHA. I have an entire slide that I'm going to skip over about why I don't like PHAs, but I'm going to go then, and this only applies to non-active aircrew and non-air crew in general, right? If you are active aircrew, you still have to do your aircrew medicals. It just coincides with your US aircrew medicals that you're doing up. There's a process to that. You're going to get your documentation from your US medical, your visual testing, your hearing testing. You're going to complete the questionnaires just like you normally would, and then you're going to send that all into me, and it's going to sort of go. Just in case, because there's a lot of aircrew in CANELEMNORAD, I made a flow chart. So your first question is, are you currently flying or controlling? If the answer is no, the next question is, are you posted to the USA for more than 2 years in a non-flying controlling position? If your answer is yes, done. No more aircrew medicals. However, if you're currently flying or you're posted for less than 2 years, you have to continue to do your aircrew medicals. So you're going to contact me when it's time to do your medical and say, hey, I'm due for my medical. Do I have to do any special exams? I'm going to say, yeah, you have to do these exams, or no, just do the regular one. So then you're going to schedule your appointment with the US flight surgeon. And the US flight surgeon is going to see you. They'll do their head to toe exam, visual acuity, audiogram. They're going to be separate appointments. You're going to complete your questionnaires, and then you're going to send all of that back to me, that complete package, all medical records and the questionnaires. And then I'm going to review it. If the package isn't complete, I'm going to send it back to you. If it is complete, I'm going to update your aircrew medical factor. It'll show up in Guardian. You'll be good to go. Keep flying. But outside of that, you can still report to me at any time. If you go see a doctor and you get a new diagnosis of something, diabetes, high blood pressure, depression, anxiety, meniscal tear in my knee, osteoarthritis in my shoulder, all of these things you have a duty to report, and you can report them at any time. When you report them, I do ask that you send clinical notes. It just helps me to review what they've done. And then I'm going to review those, and I'm going to say, hey, like, yeah, sounds good. Thank you for telling me. I agree with their treatment plan. Or, hey, have you talked to your doctor about this? And I'm also going to be like, hey, looks like with your knee, you need to be on employment limitations. Let's set those up so that you can do your rehab properly. The more you talk to me about what's going on, the more I can guide. A lot of people, they get into the medical system in the US and then they're not talking to us as a team here. And then they get overwhelmed and they get frustrated that they're maybe unsure what's going on, or they need limitations and they're not getting them. But that's what I'm here for as your clinician. I went over that. So this leads me to medical screening and cross-posting. Some of you are just coming down here. Some of you might have moved from one spot to another. Medical screening and cross-posting historically was very cumbersome for the member down here. But because now we're going to be submitting our medical records annually, and we're going to be doing our air crews, and we're going to be keeping me informed of things, it's going to get easier, because now all it's going to be like is I'm gonna pick on Lieutenant Colonel Bai is going to be like, hey doc, I'm being extended, and I'm going to go, sounds good, I got your stuff in June, has anything changed since then? And he's going to say no, and I'm going to be like, okay, make sure you send me your dependence forms, and we'll schedule your social worker interview, sign you off. And what we're not going to have is this back and forth of me trying to get the information I need to do to keep you in the US. Okay. If you're going outside of the US though, I'm not the authority for that. It still lies in Ottawa. So we have to go through more steps, but I will walk you through that when it comes. The key point here is that if you don't keep us informed, whether it's a billing issue, TRICARE issue, access issue, or a medical issue, we can't really help you. Dependent care. So coming down, the order of the room there is going to activate your public service health care plan from supplemental to comprehensive. That's done. It takes about 6 to 8 weeks-ish. And then you will get an email from them that says, you've been changed. Please register with MSH International. MSH International is the one who administers the public service healthcare plan in the OUTCAN community. Okay, so all of the claims are still going to get paid, but they're the ones that do the filing and sort of work to get the money. These two systems don't talk to each other. So there's a lot of problems sometimes, like you'll get the thing from Public Service Healthcare Plan, and then you'll try and register, and MSH International will say your email's not good. If you encounter problems with that, let us know. We can talk to people behind the scenes, and then we'll be able to get it sorted that way. Okay. If you've been longer than 8 weeks and you haven't got an email from Public Service Healthcare Plan, let us know so that we can try and chase it down along with the HRAs from Colorado Springs to say, hey, what's going on with this one? Okay. Admittedly, this is one of the biggest frustrations for the OUTCAN families. And the hard part is that it's not a frustration we can make any better. We are going to be providing some resources soon on this, partnered with CFMWS. And so I'm going to give you an advertisement for that coming up on the 8th of October. But basically, these MSH International is where you're going to claim any of your healthcare costs that aren't covered by TRICARE. So that includes co-pays. So that's an amount that you have to pay every single time you go to a visit. And a cost share, you also have to pay a deductible with your insurance down here. So the first $200 of healthcare you always pay every year. These are all things that you can claim through MSH International. And then that's how you'll be made whole for your healthcare costs down here. When going through this though, if in doubt, like this is the best thing we can do is confirm coverage. check both TRICARE and the public service healthcare plan before you incur major healthcare costs. Same would go for a public service dental care plan, but I'll talk about dental in a second. Once you've confirmed coverage, then you can go to the network provider and make sure that they're going to bill TRICARE. There's no direct billing through MSH International, so you have to pay and claim after the fact, which is why, if needed, you can request in advance. You can submit an invoice and claim by paperwork to TRICARE. I don't recommend you do that. What it should look like is this, though. All claims to MSH International need to be submitted on the online portal. Prior to submission, we recommend that you have a provider invoice that includes both the diagnosis code, it's an ICD-10 code, and the procedure code, it's called a CPT code. Captain Rogalski has a copy of these slides, and we'll make sure that make sure you have your proof of payment. It could be a receipt or a credit card statement, and then what's called an explanation of benefit from TRICARE. And that's going to come after the fact, and it's going to show how much TRICARE paid for the services and how much you were required to pay for the services. You want to have all three of those things when you submit, because then MSH International is less likely to turn around and just deny the claim because they don't have enough information. Okay. Some tips that we've learned is that multiple providers may direct bill at the same time, may not, direct bill at the same time. So you may receive numerous invoices for remaining amounts depending on when the bills came in. So providers have up to 30 days technically to bill for services. So you may see something come quickly from the hospital that says, hey, this is how much you paid for your room. But then you wait like 30 days later, you get a bill for the doctor that saw you and the anesthetist and the specialist and the consult, and those all come in separately. So the key thing to do is keep track of all of your bills as the best you can. When a bill comes in, it should always have accompanied to it an explanation of benefits from TRICARE or a receipt. If you reach out to MSH International early and you're talking to them in correspondence, take screenshots, because the messages you send to MSH International will delete after 30 days. So then if you're like, oh, what did we talk about? And you go try and open up those messages and they're gone, you have no ability to go back and try and get them back again. You can connect the MSH International with the billing department to work through large bills. Say you're going to be having a child or major surgery. If you talk ahead of time and we can assist with that, they may arrange a direct billing relationship on a one-off basis, but it's not something that happens all the time. And as always, request advances. We have probably more questions about MSH International than anything else. It is not an easy system to navigate. So that's where I just say again, reach out to us and we'll help you with that. So dependent dental is different though. All dental services get claimed directly through Canada Life through the public service dental care plan. There should be no changes as long as you did your positive enrollment once the plan changed last November. You shouldn't have to do anything other than update your address in the Canada Life portal, and then that should work for that. Verify your entitlements before you do services, because there are dollar caps as well. And ask and shop around. Dental is crazy expensive in the US. And so do shop around. And if you're wanting to get a predetermination, and send it in. You can send something to the public service dental care plan for like braces and say, hey, how much of this are you going to pay? And then you'll get a predetermination on that. Dependent optometry. So that is covered under TRICARE. So you can either, if the MTF sees family members, you can book it there. You can go to a civilian network optometrist and have your eye exam done there, but they do not cover glasses. If you do go to a civilian optometrist, it is only covered every 2 years unless you have a medical indication as to why. Diabetes, glaucoma, something that would cause you to have it done. Make sure you get a copy of your prescription from your eye doctor, because we recommend you save costs by using things like Zenni Optical, Warby Parker, or Costco. Wholesale glasses, people will provide much cheaper glasses. Ask about military discounts. Many eye doctors provide military discounts. When I went to put prescription lenses in my sunglasses, my glasses were 40% off because I asked if they had a military discount. If you get referred to ophthalmology from an optometrist office, that becomes like full TRICARE, and all the care will be covered that way. There are a few extra service claims, and Taylor, I know I'm moving as quick as I can. So one thing is that if you see anything on a explanation of benefits from Public Service Healthcare Plan, MSH International, or the Public Service Dental Care Plan that doesn't make sense, like they didn't cover the full amount, or you get a letter that says excess dental, reach out to us, because just being international, there's certain things that get covered. They base everything on Ontario rates. So if it's too much money for Ontario, sometimes they'll put a code there that we claim through the Foreign Services instructions. Other things like if you need immunizations for school or work that are only covered to 80%, we'll cover the rest of the 20%. Medical travel for dependents is covered under the Foreign Service instructions. Interpreter fees, if you need someone to help speak any language to help better understand your care, is covered by the Foreign Services instructions. And then one key one I do point out here is that the registered nurse anesthetist is a trade that doesn't exist in Canada, so they can't pay for it, but it's commonly used in childbirth in the US. So if you do get seen by a registered nurse anesthetist, that will be claimed through us. The long and short of this is that sometimes if you're like, hey, I'm out of pocket for something and it doesn't make sense, reach out to us and we'll see if it fits under any of the FSIs. The orderly room there is also going to know all of those as well. Whenever we file a claim with the FSIs, all we need is your proof of payment and your explanation of benefits or excess dental letter from MSH International or TRICARE, and then we'll work through. The last thing I want to point out is our website. This is actually the key thing, because all of the information I just went through here exists on our website. This is our current website here. And but coming soon, partnered with CFMWS, is our new website, and it's going to look something like this. So you're going to actually be able to better understand your coverage based upon if you're a CAF member or a family member, what type of position you're in, whether it's DoD sponsored, you're on leave without pay, or non-DoD position. All of this, and then you're going to say, okay, who does this apply to? How do I get care? Everything like this is all going to be on our website. And so this is going to be our best source of information. The new website is going live on the 8th of October, partnered with Ashley Young, who's been doing a ton of work on this with us with CFMWS. So shout out to Ashley and her team of one, which is her. And our website is accessible from any network. So bookmark it, pass it on to your spouse, your family members. It's going to be sort of great to have. Mental health, couple points quickly before I pass it off to our TRICARE friends. Canadian Forces Member Assistance Program is available for both members and their families when you're posted OUTCAN. So if there's something you need support for, transition help, anything like that, that is a resource you can tap into. The MFS also has a U.S. social worker, Marion Hall, and she can, her information is linked there at the contact. You can reach out to her. That is for family members only. There's also, I always point out, the U.S. crisis line is 988 for any sort of crisis mental health support that you might need. I'm going to skip through my need to knows. You saw them to begin with, to point out this, which is, this was like a blitz of information. I get it. Healthcare 101, Navigating Healthcare in the U.S., an information session for CAF families is going to be Wednesday, October 8th, partnered with CFMWS. So do try and put that on your calendars. We are doing it at 8 p.m. Eastern so that it sort of catches everybody after the working day so that you guys can attend virtually, and hopefully we will answer a lot of questions there that maybe you might have. Our contact information is all there. Taylor, I think I'm going to hand it back over to you because I think Miss Martin and her team is there, and then I'm going to stay online in case there's questions because I know I took some extra time.
Awesome, thanks, sir. If it's okay with you, we'll hold questions until after the TRICARE presentation since it's all kind of the same topic. Awesome.
100%. I will stop sharing.
Karen and your team, if you could come up and introduce yourselves. This is our BCAC. They are all accessible at the TRICARE Operations Office. When you guys are speaking, if you could speak into the mic because there are folks online. So I will hand it over to you. There's a clicker right here. the thing, you can. It's up to you. Awesome. Thank you.
So I am Captain Larson. I'll introduce our team really quick. I'm the flight commander of the TRICARE operations and patient admin flight, so TOPA. So we are not located in the main clinic that's over here at the corner of Stewart and Peterson. We are the building next to that. We're in the medical annex building. It is building 725. So if you know like where the tennis courts and the pool is, sort of, we are directly across Ent Avenue in the medical annex building. So you can just come into our main lobby there, and our flight has a front desk in the main little lobby of that building, and we're standing by ready to help. Again, I'm Captain Larson. I've got my flight chief here, Sergeant Ian Opolo. We actually have 3 members of our flight that are trained as BCACs to support you guys. We have Miss Karen Martin, who is the primary. We also have Sergeant McVeigh, who's going to be briefing you today, and Airman Dixon. And then if you guys also have, as you're leaving here onto your next assignment, if you have records needs to take your records with you for any care that you've had done while you're here, we have Airman Hamilton here, who is one of our records clerks. So I will hand it off to Sergeant McVeigh.
Okay, so we're just going to talk about the insurance piece when you guys are choosing to get care either at the MTF or at a civilian facility. Okay, so upon arrival here, you are going to check in with DEERS. DEERS is at building 350 at the MPF where you get your ID cards at. What they're going to do is they're going to input you into the system, and that will show that you're eligible for care as a foreign affiliate. After you go to DEERS, you will show up to TOPA at the MTF. We will put you into our electronic record system, and then you will be good at that wise. Do not call TRICARE. I don't care how many people tell you to call TRICARE. Do not call TRICARE. For our active members, if you need any outpatient care, you are going to call our appointment line. It's written right there. It says routine 1, urgent. I just click 1 for everything until I get an operator. It works. And then you will actually not get a PCM while you were assigned here. What's going to happen is when you call the care line, you're just going to let them know that you're a foreign affiliate member, and then they know who to schedule you with. If they do not, then you can give us a call, and then just make sure you know who you talk to so that we can address that issue. Any ancillary services that you need, that's going to be lab, radiology, pharmacy. You need an order from your PCM to get those, and then any specialty care. I know your business rules say that you don't need a referral, get a referral. The reason that you need to get a referral is because if you need to be reimbursed from your embassy's insurance, if you do not have an EOB, you will not get reimbursed. All inpatient care requires a referral. Next. And then for our family members, it's typically the same. The only difference is typically they say family members don't need referrals, get a referral. And then any inpatient care, it's not covered by TRICARE. So that's something that you would have to talk with your insurance about. So Fort Carson down south, they have an ER that's open 24/7. They also have where you'll see most of your specialty cares at too, if you require those. So for pharmacy, so you will need an actual prescription from your PCM, so you can fill your scripts on base at the main clinic pharmacy, at the satellite pharmacy that's at the BX, or you can do the home delivery services. It's done through Express Scripts. Pharmacy can help you set that up. I'm not good at that part. Next slide. So for dental, all of our active members for dental have to use the dental clinic that is on base. If you go to a civilian provider without a referral from dental, you will be on the line to pay for all of that. Next. For our family members, you cannot be seen at our actual dental facility on base. They don't see any dependents. They only see active duty members. So you'll have to contact and coordinate through Canada Life. Questions? So for resources, Mail Connect, you can go through Mail Connect and you can update your DEERS information, so phone number, address, all of those. It's important that you have that information up to date, because if you do have to get a referral, that information is pulled from DEERS, and if it's wrong, then they have no way to contact you. So it's important to make sure that your information always stays current in DEERS. Canada Life's information's up there. This is TRICARE's West's number. People ask for it, but do not call TRICARE.
So with the Tri-West, the resource that's up there, we include that is we encourage, if you would like to know about your TRICARE approved letters, if they've been rejected or denied, that is a link that you want to use to create a username and password. This way you'll be aware of any TRICARE that was denied, and then it's going to give you the remarks on why it was denied. And again, you can come to us. If we can actually correct it and fix it for you, we would do it. But that's a really important link to use. So this way you can see and keep up with all your TRICARE approved letters when you're referred to the civilian network, especially a lot of your dependents. They're going to be one that I encourage and strongly suggest to put and build that account for your dependents. This way they can keep up with it and see from the patient portal in Genesis, from when you see the provider, when the medical appointment goes, because TRICARE database works in conjunction with MHSS Genesis. Yeah, power chart. I know a lot of you, it could be confusing, but MHS Genesis is the link, is the database to where when you communicate with your provider, that provider is going to put that information into a referral, and that referral is going to go to. So that link is very important for all the dependents if they want to just kind of keep tabs on the TRICARE approved letters. As far as the active duty too, when the time comes, if you get referred off to the civilian network. Any questions?
If I can, Ms. Martin, I'm going to just add a little point there. So many of you guys will have a CAC card, which means your access into MHS Genesis will be secured through your CAC login. When you register at DEERS, make sure you input an email address for your partner, for your family member, because that family member email is what they can use to make their DMDC logon. So then they can get access to all of these things. If there's no email in there, then that'll be a point of contention. Learn that the hard way.
Very true. Very true. Thank you for adding that.
So in reference to this DMDC, the MHS Genesis portal, I know that I had an issue with getting access to it, as many of folks who don't have NIPR access. We don't have CAC card readers and things like that to log in. Perhaps we can provide a phone number. I don't know if you can do it on this link, but I did get connected with DMDC to add my personal email into MHS Genesis after the fact. I don't know, perhaps we can provide the phone number or something. But it's MHS Genesis is the most helpful thing for all your medical care needs. So once you get your personal email address in there, if you didn't do what I did, also what Major Martin didn't do, you can do it after the fact also. I'm assuming by that website. Correct me if I'm wrong.
We have Senior Airman Dixon who can kind of elaborate with that.
There you go.
Because him, like McVeigh and myself, also do the patient portal champion. Oh no, I don't do the patient portal champion. So where we can give you guidance. I'm gonna let Senior Airman Dixon talk.
All right, good morning. So yeah, the question that she had, and I would say for if you have or whenever you do come to our front desk, we do have a QR code. If you're unfamiliar with the Genesis and registering, it gives you like the full step-by-step guide to register. And yes, as Major said, make sure you do include like a username or an email or something, because yes, if you do not have a CAC reader at home, or whatever the case may be, you will not be able to get into your patient portal outside of work. So that's all I have for that.
And you by creating an account and a username. So it can be created without a CAT card for the dependents who may not have that CAT card. You can obtain it from us as well in TOPA. Any questions?
So the first three are going to be contact information for myself, Ms. Karen, and Airman Dixon. Dental's number is going to be up there. So for our active members who need any help with anything dental related, you will contact dental directly. For family members who might have questions about dental, who to go see, dental can help. They can't see you, but they can give you some resources too. And then pharmacy, that link is for their home delivering services for people who have meds that they have to take every day just to be delivered. And next, that's it. Any questions? No?
So
We do
I'll just
have.
I will jump in on one clarification just on the Express Scripts home delivery. So that is not eligible for CAF members, only our families. We have walked through that pathway a whole bunch of different ways. So it's only family members under the select group B who can get home delivery via Express Scripts. However, what I do recommend, no matter where the prescription is, go to the MTF pharmacy because that's where you're not going to have to pay any costs.
We do have a couple packets of fact sheets that are helpful info. I don't know if we have enough for every person. What is there a table we can put those on, or a best place to? We'll put them in the back here, and you can grab one each of them on your way out. So, yeah, yes, absolutely.
Awesome. Thank you so much. Appreciate you guys coming over here. Major Martin is still online. We have a few more minutes. So if anyone has any questions about the medical field at all, they're here now. Otherwise, you'll have to reach them by the phone numbers and emails that they posted up here. Does anyone here or online have any questions for the medical team?
I just want to say, for those that are there, obviously, like, this team is amazing. We've met with them when we were out in Colorado Springs. They want to help us because we do face issues. So for any of the debt COs, we are working to coordinate TOPA into your groups so that you can get this sort of same relationship that we got going in Colorado Springs. So do reach out to us on this, and do reach out to these people. We hope that you've seen them in person. Now it takes away the mystery of going to that TOPA building and talking to them in person there.
Thank you, Major Martin. This is Lieutenant Colonel Gorlov. Just a simple question. Maybe you mentioned it. Do we have a copy of your PowerPoint that you presented us this morning available to us?
Yeah, I gave it to Captain Rogalski. She has a copy. I will send her also the updated one because I was making changes even this morning. It's obviously recorded as well. So yeah.
Yeah, I'll just add to that. All the presentations that are happening today, it's being recorded, and they'll also be available on SharePoint. I'll share the link after the fact. Sir.
Just a question for Major Martin. Is there a CAF medical policy on eligibility for COVID vaccines? It's quite possible we could be in a place where you're not eligible for a vaccine because you're under 55 or not of any special health risk. But I know even in Canada, different provinces have different requirements. So is there a CAF policy on that?
So from the CAF perspective, for going into COVID and flu season, is that the COVID vaccine booster is a recommendation that you should, not you shall. Obviously, you should get it. We don't have restrictions on the COVID vaccine. I will double check the policy, but I am not tracking any restrictions on the COVID vaccine as a booster within DHA. They may be waiting so last year they did a massive campaign. But they don't roll it out till October. So I don't know if they're waiting to start their campaign. If you got a denial of a COVID, like you wanted to get one, just reach out to me separately and we'll get it sorted, but it should be approved.
Okay, the only question was if we're in a place where we have to pay for it, will we be reimbursed?
Yep, 100%. So if you don't have access to an MTF, you're outside 50 miles from an MTF, we will reimburse it.
We have another question.
Hey, Jaron, it's Ennis. This
Hey.
is either for you guys or the TOPA team. Because DOD has been restricted for the COVID vaccine specifically, so DOD is not entitled to the COVID vaccine. That is what I've been told, that unless they have a comorbidity, the current direction coming out from them is the COVID vaccine is not something that DOD members will be given. How do we get it here?
That for one thing, because if that is a change in policy, they have not updated that policy as of yet. I was just talking to the vaccination person at Walter Reed. They actually want to come to the embassy here to do us here because they think it'd be good PR. So they're planning massive vaccination parades here on the East Coast. So let me look into that, and I will communicate out to all of NORAD the COVID direction. If for some reason DOD is not going to be giving it, then all members will be authorized if they want to with just my bulletin that comes out to go get it and submit for reimbursement. You won't have to contact me individually for those.
Yeah, hey, Major Martin, this is Ricky Smith. I'm the DHA LNO to Northcom. So I'm coordinating the vaccine program for mass vaccination at the Northcom headquarters this year. We will be doing flu, and we'll be sending you the schedule on that. And then for the U.S. military DoD service members, they were waiting for some additional guidance, but they may require a prescription in order to be able to get the COVID vaccine. So consider that as you're coordinating there on your end. And if that's the go-to thing that we need to do to where your Canadian service members need to get the COVID vaccine, just the prescription, and then they should be able to get that done. Does that make sense, over?
Yeah, that makes sense. Thanks, Mr. Smith. Yeah, like I said, maybe the left hand and the right hand are still talking. I don't know. Sometimes things come through the net early. And so I will definitely make sure that any CAF member that wants to get the COVID vaccine will either get it through DOD through their mechanisms or be funded through Blue Cross. No, full stop.
Any more questions for the medical team? If there's anybody online, feel free to speak up. I don't see anything in the chat. So that's it for you, Major Martin. Thank you so much. Thank you, BCAC team. We really appreciate you coming out to help us out here.
Yeah. So please, please, please be in touch. I'm happy to help anybody. We are on standby here always. Thanks, everyone. Enjoy the rest of your orientation.
So next up is Children Education Management. Kelly, if you're online, could you go ahead and share your screen now? The floor is all yours.
All right. Well, I'm Kyle Clotter with Children Education Management. I'll be presenting with Kelly as well today. So if you could get the next slide going. Well, can everyone hear me? It's all clear.
Good on our end.
Perfect. Okay. So if you could get the next slide. Oh, we got a question. Oh, okay. So our team here. So in Colorado Springs, we have Mass Corporal Joseph, who I believe is there right now. So she helps with all the working group B claims, your regular FRT, education, travel, all these regular claims. In Ottawa, so the Director of Children Education Management, that's Marc Bélanger. He's the final authority on all the decision making. He's been here for over 10 years. Then for the FSD coordinator, that'd be myself. I'm the point of contact for all entitlements, the OUTCAN signing authority, and I help finalize all the claims, and then the working group lead claims as well. Kelly joined our team a couple years ago. She's the SAM finance manager. She does all the section 34s, finalizes claims, and is just our financial guru. Next slide, please. All right, so the three policies we take care of for the military members themselves, that would be Military Foreign Instruction, MFSI 10. However, since we deal with the dependents, MFSI 10 actually refers to the Foreign Service Directive for anything to do with dependent education. So that's where we have to apply the Foreign Service Directive, just like every other department or government department when it comes to children education. When you're inside Canada, there is the Compensation Benefit Instruction 12. So that does provide some allowances in Canada for provincial moves, and we'll touch a bit more on that later on. Next slide, please. So these are the main policies we deal with, the definitions, FST 30 post-transportation. So that's travel via PMV or commercial transportation to school when it's not provided. Education travel and accommodation travel, getting dependents to and from post-secondary school or secondary school, and then having the ability for a family member to go with them, accompany them on that first visit to school, getting set up for university and all that. We also got the family reunion travel. So there's different ones where you can travel third location, or there's travel in lieu of the entitled dependent. But as I mentioned, we'll go into a bit detail further on. Next slide, please. So FST 34 education allowance, there's 3 different tutoring benefits. One of them applies for the duration of the posting. So the tutoring in the other official language up to 50 hours. If you were taught in English in Canada and you're attending a French school or vice versa, you can get up to 50 hours of tutoring in that other language. The tutoring in subject, there's 2 different benefits for either first year at post or the first year upon return to Canada. And that has to go through the Interdepartmental Coordinating Committee, which is Working Group B, where DND and 9 other government departments sit on this committee twice a month. They go through all the cases and provide recommendations for the different governmental deputy heads to provide approval for these cases. The other one that really applies for Colorado, so there's JKSK fee-paying schools because the age entry requirements for most of the schools are usually 5 years, 4 years as of 1 September. So in Ontario, you have to be 3 years, 8 months or 4 years, 8 months. So that's where if you're attending a school that's not on the list of compatible schools or a public school, we would have to go through that process. There's also the ability to attend a Roman Catholic school. These are all done through Working Group B as well. Boarding school in Canada, if ever you wanted to leave your dependent in Canada, there's about 4 or 5 different boarding schools that are approved across Canada that are other options. We also have post-secondary shelter assistance, and then there are different admissible and inadmissible education expenses. Next slide, please. All right, so the in Canada, I'll just touch on that real quick. So there's language tutoring and private tutoring. So these apply when you move from province to province. The most obvious one would be if you come from Quebec, you move to Ontario, Alberta, and there's no French schooling option available. You must attend English language school. There's that ability to get a letter from the principal, and we will provide tutoring based on that letter of recommendation and the specific courses for that for the duration of that school year. There's also the ability to leave your dependent at the previous post or at the previous province, attend a registered boarding school. And if that were an option, then there's 2 return trips per year to be able to visit your dependents. One quick note, CBI 12 does not recognize French immersion programs. So as per Section 23 of the Canadian Charter of Rights and Freedoms, French immersion programs are optional programs for Anglophone pupils and are not guaranteed under this section. So a member has no entitlement to education allowance in respect of French immersion programs for dependent children. All that to say, any French immersion program is deemed as an English language school. That's how we look at it from a benefit and allowance perspective. Next slide, please. And by the way, sir, if there's any questions, I can address them at the end. Just write them down. We'll definitely have time towards the end to go through any detailed questions or scenarios.
I am also answering in the chat, so any ones that pop up in the chat.
Thank you. Just noticing that. Okay, so we have our guidance counseling service team. So what they really do, the big thing is helping with the screening process, ensuring that there will be that compatible education, that seamless transition, OUTCAN, and coming back afterwards. They're always available. If you have any questions, just reach out to Julie or Paul. They'll definitely help you with any guidance with regards to what prerequisites they might need for a certain university course and different entitlements like that. And then a big key thing as well is the curriculum reviews for the schools. So when a school is not on the public system, so grade 1 to 12 public English system in the States that's deemed compatible, any other school, a Roman Catholic school or JKSK fee-paying schools, we need to do curriculum reviews to confirm the compatibility with the Ontario curriculum. So that's where we have to have these subject matter experts go through the curriculum, obtain that information from the principal or a point of contact at school. And that is quite time consuming, but it really just ensures that there will be no problems or mitigate as many problems as possible attending that school, but most importantly, coming back, making sure that transition will be as seamless as possible. Next slide, please. So kind of touched on this. So that's where I was saying the non-fee paying schools, so English public schools should be used wherever possible. As I mentioned, the age requirements, that's where it really comes in. So if there, per state, it varies. Usually it's 5 years, sometimes it's 4 years, but I have a list of those as well that I will make available afterwards so that you are just made aware and know that. It's English and French only. So if there's a full Spanish school with no English or French, that's not something we would ever deem compatible in the States. And then Roman Catholic, there's three little prerequisites. Either have a proof of parish, you were previously baptized, or you had attended a Catholic school prior to post in Canada. And the most important thing, just make sure the school's on the list of archdiocese. We can verify that. We verify that all the time, and that's where we're trying to push to on the next cyclical review, where we're going to add the Roman Catholic schools that are on the list of archdiocese as compatible education. So we don't have to go to working group B anymore. We can just approve these internally. But until that's done, we have to do the curriculum reviews, go through the committee and that entire process. Next slide, please. So these are just the little eligibility requirements, and these are all based in Ontario, and there's really no flex on that. So for the 3 years, 8 months, as of 1 September, if your dependent's 3 years, 7 months, 20 days as of September 1st, and the school is willing to accept them in junior kindergarten, we will still not approve that because it's the transition back to Canada that will be affected. So it's really, we are very, very strict, and the committee is very strict on these age requirements. They must meet them. Documents required when attending these schools. So just the school calendar schedule. We'd like to have the curriculum, but we can always obtain that ourselves. Just the application fees, all the tuition invoices, and the receipts. Grade 1 to 12 fee paying schools. So those, they won't come up too often because, like I said, the English system is deemed compatible. So that would really only be Roman Catholic. But any school from grade 1 to 12, any admissible education expense, we will reimburse for those as well. Next slide, please. So yeah, this is the Roman Catholic from JK to grade 12. So Roman Catholic education, comparable to that provided by the Ontario Ministry of Education. So an education allowance on behalf of a kindergarten, elementary, secondary student who has attended the age of 3 years, 8 months, but not over 21 years of age as of 1 September. This allowance is only applicable if a non-fee paying Roman Catholic school is not available at post. All requests for these Roman Catholic schools must go through working group B and be reviewed on an individual basis. So I have yet to see a non-fee paying Roman Catholic school available at post. If there is, that'd be the first one. So most of the time they will have to come, well, all the time they'll have to come through working group B and for us to review on an individual basis. Next slide, please. This is touching a bit more on the tutoring. So to help ensure that basic instruction in the second official language is provided to students, 50 hours second official language tutoring per school year, except for children in JK and SK. So if you're entitled to French tutoring when attending English language school and entitled to English tutoring when attending a French language school. So we just need 3 quotes from, sorry, I think I muted myself. So we need 3 quotes from local tutors, receipt from the tutor at the time of finalization, and then just proof of payment. And hopefully broken down per day so that we can do the conversion rates for those weekly invoices. Next slide, please. Okay, so this is where tutoring and subject first year at post. This can also be French and English, but it could be a specific subject. So whether it's math, English, a lot of them would be, if you're coming from Canada, you've only done Canadian geography, and now you're going to the American, they're making you take American history. You have no background, or your dependent has no background knowledge on that. We just need that letter from the principal. The academic deficiencies got to be attributable to foreign service, so attributable to relocation. And then that's from there, we would bring all that information, go through the report card. So for this specific situation, if there's no geography on the report card, the principal is recommending tutoring in history because the child's never taken this course, 2 hours per week until the end of the school year. So the committee, we will recommend approval up until the next report card. We want to see that next report card to see the dependent still below that class level, or the principal still recommends tutoring. From there, the committee would reconsider if we still will continue to provide tutoring until the following report card. and these always end up at the last report card. So tutoring, the 50 hours in the other official language, you can do throughout the year whenever you deem best. For this, because we have to go through working group B and because of the specific requirements of being below a grade level and proof of a deficiency, we can't dictate that after the first or after the final report card for those 2 summer months. So that's where tutoring first year at post in subject is only during the school year, the school calendar year. Next slide, please. Also, I did want to mention, so sorry, there is tutoring upon return to Canada. So this hasn't been talked about too often, was pushed by Treasury Board. I think it was 1 September 2015, but not a lot of departments were informed. So it's the same process as first year at post. However, we would just do the same thing for return to Canada. The gaining principal could just recommend, okay, they've never taken this specific course, or because of the English taught there, they're going to be struggling in this specific course. We can also provide that the same reimbursement for tutoring up until the next report card. If it's still a deficiency is shown, then we can keep that ball rolling. So these admissible education expenses, these are for schools that are on the list of compatible schools. They've been deemed compatible. They're on the list of archdioceses. We will reimburse these fees. So the non-refundable registration fees, non-refundable application fees, you can apply to a few schools to make sure you secure a spot at that school, or you secure a school at post. However, as I mentioned previously, if you apply to 3 different schools, but one of them is a full Spanish school with no English, no French, would never be deemed compatible or comparable to the Ontario Ministry of Education, we won't be able to reimburse that just because it would never have been a compatible school. So those are the couple of points that I would just verify when applying to multiple schools, just make sure that they're good to go. But from our end, we will reimburse you on all those, the tuition fees, library fees, computer user fees. Those are different things that aren't really talked about too much. But if you have any questions or any specific scenarios, feel free to always come to us and we can definitely clarify, or Master Corporal Joseph as well can definitely help you out with those. So next slide for the inadmissible education expenses. All right, so these are inadmissible education expenses. I'll just touch on a few of them. So school uniforms, sports equipment, purchase of rental or of computer equipment, and then music and dance and all that stuff. So these are inadmissible education expenses that would be out of pocket for the member, because in Ontario, we do not provide these for our dependents. So it's on the, it's this, we're treating it as the same as in a family in Ontario. So it would be the responsibility of the parents to take care of these fees. Next slide, please. Okay, so deductibles of the tuition. So in FSC 34, there's Appendix A, which refers to all the different member deductions, school craft supplies, post-secondary shelter amounts, shipping amounts. We have to, at the committee every year, we have to establish rates for all of these different amounts, and then we post them yearly. So these are a couple of the key ones that aren't really talked about, but that may come up quite often. So school craft supplies, JK to grade 8 and grade 9 to 12, that's the member that we're willing to reimburse. And then for the IB AP programs, there are a lot of IB exams for the grade 9s to 12 levels, depending if you're going to an international baccalaureate school, but these are reimbursable. So the 185 per exam, you may have up to 3-4 exams. We'll reimburse up to 185, maybe a little bit more, but that's where that is something that can be reimbursed. The midday meals, I don't see them come up too often, but it's basically just the member's share. As long as it's including the tuition, the invoice, they break it down. You just have to cover the 327, and then the rest will take care of that. But once again, if there's any specific situations or any questions about those, please feel free to come to us and we can definitely clarify some of those. Next slide, please. So yeah, this is the elementary and secondary education in Canada. So if ever you wanted to leave your dependent in Canada, didn't want them to go out camp for whatever reason, they were already at Ashbury, or you wanted them to stay here. So there are a few different schools. This would always have to come through SEM Ottawa, mostly through our guidance counselors. They will be the ones to actually just deem, okay, this is good to go. This is a good fit. It's compatible for your dependent, your family, and your situation. So there's Ashbury in Ottawa, Lakefield in Peterborough, Laurentian Academy in Quebec, and then King's Edge Hill in Windsor, Nova Scotia. So those are the 4 we have right now. There might be a few others, but we haven't had any dependents go there yet. So they're not on our radar, but there's always the option to have other ones. We would just have to do a curriculum check, verify ensure compatibility and all that. Next slide, please. Okay, so post-secondary education in Canada. So there is a shelter allowance that can only be received in the HQ city. So that's up until the 23rd birthday. The dependent must be in full-time attendance at a Canadian post-secondary institution, whether that's college or university. Signed copy, the lease agreement, letter of agreement, terms of agreement, anything like that with the lease. So for university, it's up to 8 months, college 9 months. That will be amended because we did add per trimester now because there are summer terms. So all in all, you can get up to 6,684 per semester. So your fall semester, winter semester, summer semester, as long as it's proof full-time attendance, we have the signed copy, and you are not attending a co-op program. So that is one thing. If a member's in a paid co-op, you are no longer entitled to that. And the other thing would be if you are an ROTP or if you go to RMC, you're no longer entitled to post-secondary shelter assistance. And obviously the dependent must be on the MPR and the posting message. Next slide, we'll just touch a bit more on shelter here.
Did you want to mention just the real estate incentive?
Yeah, I was gonna, okay. So
Okay.
I was gonna mention on the next one. No, so as of last April 2024, Treasury Board kind of pushed this change in the CAFRD and MFSI 10 where if a member elects to receive real estate incentive, they're no longer entitled to receive post-secondary shelter assistance. The unfortunate thing, Treasury Board didn't really tell DCBA or us, so we weren't really made aware until a few months ago. So that's we're figuring that one out. But moving forward, when members elect the REI, there is no, it's irrevocable. So that's a big consideration because I think you get 12,000 or something a year for REI. Whereas if you didn't elect it and you were entitled to shelter, you could get up to 20,000 per school year. So that's a big impact to consider. So that's something to definitely be aware of moving forward as well. Thanks for that, Kelly. Yeah, so this is just a quick breakdown on the shelter assistance. So let's say your HQ city was Yellowknife. There's no university, there's only college there. So that means your dependent would only be entitled for shelter reimbursement to attend the college in Yellowknife. So they wouldn't be entitled to attend a university in North Bay to get reimbursement or anything like that. It's really whatever post-secondary institutions are available in your HQ city, those are the ones that are entitled to be reimbursed for shelter assistance. So there is education travel and family reunion travel for post-secondary students. So it's from post to the location of the school, but it's reimbursed up to the cost of a flight from post to the HQ city or your last Canadian post. So if the flight is not to the HQ city, a quote for a flight from post to HQ city has to be provided for us to determine maximum entitlement. So example, last Canadian post is Ottawa, dependent goes to University in Vancouver. Quote has to be provided for a flight from the current post to Ottawa. Actual flight costs will be reimbursed up to the amount of the quote. And then that remaining share would be on the member to take care of the remaining amount. Next slide, please. Okay, so education travel. So this entitlement is different if it depends on attend secondary school or post-secondary. So for elementary and secondary school, reimbursement is for the actual and reasonable traveling expenses from post to a school approved by the deputy head. So that's either approved by working group B, it was on list of compatible schools, anything like that. For post-secondary, reimbursement for travel expenses up to the limit of a journey between the post and the HQ city. So that's up to what we will reimburse. And then the eligibility, student must be unmarried child of the member spouse, be in full-time attendance in a post-secondary educational institution, except RMC or ROTP, have resided with the member prior to the posting, except when in full-time attendance in a Canadian institution. Next slide. Okay, so there's also accommodation escort travel. It used to be called escort travel. They changed it last cyclical review. So now it's accommodation, but it's a one-time allowance to accompany the dependent student from post to school to the first year. The child is educated away from post. First year he or she attends secondary school away from post, and then the post-secondary, a student younger than 21 who graduated from a secondary school outside of Canada. So escort travel will not be authorized where the child's other biological parent or legal guardian resides in Canada. The required documents, the main one is the itinerary, but also must be booked 4 to 6 weeks in advance, economy standard, and then proof of school attendance as well, receipts, the Google map from to and from the airport, as well as the posting message. Only applicable where the provision of FSD 51 is not applicable. So education travel, you only receive education travel if you are not entitled to FSD 51 in that specific situation. And as of this year, we added 3547. So travel up to 5 days before or after the dependent travel dates for operational requirements. So if for some reason your dependent has to go August 28th to residence to get set up, but you cannot go there until the 30th or you can only go the 26th or something, there's that flexibility to go 5 days before or after, but you just have to provide some justification for operational reasons or other factors. Next slide, please. So these are the 4 different FRTs that we have under FSD 51. The most common ones, the dependent will travel to post, come visit the family at post. Third location, so that's the third location is we want you to meet on the most direct route possible. So if you're in Australia, you're not going all the way across Canada to meet. You're going to try to meet en route somewhere. So those are that's a key decision for the third location, is trying to meet en route. But also for the travel by parent, so basically a reverse FRT or third location, any of those travels will liquidate from all eligible dependents. So for example, a dependent who's in elementary or secondary school would be entitled to 3 family reunion trips per year. By doing either a third location or a travel by parent, so a reverse FRT, that's going to liquidate one from all of the travelers. So that's something to consider as well. Visiting under custody agreement, that's another FRT that we have. Yeah, so parent travel on FRT liquidates 1 FRT from each dependent. If any one of the dependent has 0 FRTs left, DND will not reimburse for parental travel on FRT. So that's a really important part to know. And definitely if there's any questions afterwards, we can go a bit more into detail and I can clarify all of that. I just want to do a quick overview here. Next slide, please. So this is just for the visiting under custody agreement. So up to 2 return trips per school year. Reimbursement is the cost of the airline ticket less the cost of travel between the location of the child's other parent and the employee's HQ city. So the member share. We need a signed custody agreement, not just a PKI card signed with the member and the ex-spouse and a Word document. Like, we need it signed, legally binding. If you don't have one, you can always, or if you lost your original copy, you can always go to the courthouse. I think it's $150, $250 to get the original back. So there's no entitlement for escort travel unless child has special needs. So if it's a personal decision between the member and the ex-spouse to write in the custody agreement, if our dependent travels OUTCAN, one of the parents must always travel with them, that's fine, but we're not going to reimburse for that. That's not in the policy. Unaccompanied minor fee may be reimbursable. So reminder, a child's age out from the custody agreement once they turn 21, unless they're dependent with special needs. So I'll just jump to the next slide real quick, just show the FRT entitlements. So the biggest thing for us, it's got to be booked 4 to 6 weeks prior to travel. There is a line in which if it's not booked within 4 to 6 weeks, the deputy head may authorize it, but we have to have justification and reasoning. If it's, I just didn't know and I didn't send it in, I'm not too sure how that's going to fly. So just be aware of that. The sooner you can book it, if you can initiate 8 weeks ahead, and then, all right, here you go. But we understand sometimes you don't know when your dependent might have their winter leave and all these different factors. So just try the best 4 to 6 weeks ahead. Actual or reasonable transportation expenses to and from the airport. So that's why we need that distance to and from, so we can make the calculations. Reimbursement is up to the cost of travel between HQ city and the post for the post-secondary student. The school students and child not in school. Quotes to the HQ is required if flying to a different location. So basically, these are the key entitlements. So secondary school students, or elementary and secondary school students, you'll get 3 trips per school year. Post-secondary, up to your 21st birthday, you'll get 2 trips. If you're 22 to 23, you'll get 1 trip. And the ages, it's how old you are as of September 1st. Because for school years, it's September 1st, August 31st. So whatever age you are on September 1st, that will apply for that duration of that school year. Dependents non-school, so 18 years of age or younger, you get 2. 18 to 21, you would get 1 with the SEM approval prior. And now last slide is just our contact information. So we've got the Colorado Springs plus box there. We've got our our SMG plus box here, and then our SharePoint as well. So that's where you can find this PowerPoint. I'll be adding the French one there as well. We've got all our list of compatible schools, how to find a list on the list of compatible schools, a variety of FAQs with regards to FRTs, education, travel, just FST 34 regular generic questions. But yeah, if there's any questions now, I think we only have about 5 minutes left. We can try to address them, but if not, please feel free to shoot us an email, and we'll definitely get back to you guys.
We definitely have some questions in here, Kyle. And I wanted to introduce Master Corporal Joseph. She's in the room. If you can just stand up. She's our local SEM person. So if you have any questions, please don't hesitate to reach out to her and the plus box. I think it was
Yeah, my question is the family reunion travel, does that work in reverse, as in my children elected to stay in Canada with their mother? Would that allow them to come down to visit me utilizing that benefit?
So that wouldn't be, if your dependents are coming down, that wouldn't be a reverse, right? So that would just be a regular FRT. If your dependents are in Canada, come to see you, that's a regular FRT. A reverse would be you're going to them. That's what a reverse FRT would be. So that's travel in lieu or a reverse FRT. So you're traveling in lieu of the dependent to go and see them instead of them coming to you.
Kyle, do you mind commenting on the unaccompanied versus accompanied FRT issue?
So unaccompanied versus accompanied. So we don't deal with unaccompanied. We just had a meeting with DCBA for Thursday with Treasury Board as well, just to clarify. So anything to do with unaccompanied FRTs, that goes directly through to DCBA4. I can add their positional mailbox as well. But we really only deal with FRTs with dependents. So if the dependent's traveling, third location, or travel in lieu, as well as the custody agreement. So those are the 4 dependent FRTs we deal with. If it's unaccompanied, that goes straight through DCBA4. And then I believe they've deemed it that their URSs or the support units will be the ones to help them with all that.
Yeah, so that's myself and Master Corporal Joseph. So if you're unaccompanied here, please reach out to us for those.
Perfect.
Any other questions here in the room? I saw a couple hands. Anybody else? Yes, maybe. All right. I think that's it, Kyle. Thank you, both you and Kelly, for presenting to us today. Appreciate it.
Thank you, everyone.
Thank you.
Thank you.
Mentioned at the beginning, the welcome book needs a lot of work. The team's already put a lot of work into it, but I would really love to get a couple, at least spouses or family members. I've heard there's a couple who've already done a lot of like scribble work in it. So if you can please identify yourselves to Taylor if you want to help. We're going to put like a working group together with the team, whoever volunteers, the MFS staff, and make sure that the people arriving next year have a much better product. The other thing, and Taylor, I might be stealing your thunder, maybe you're going to do this at the end, but my understanding, having not been here last year, there's big improvements to this from what happened last year. If you have any ideas about things that we didn't need to talk about, or things we really missed, or things that we need more time on, please let Taylor know as well, and we can incorporate that into the welcome brief for next year as well.
Hello, everyone. Thank you for coming. I am Master Warrant Officer Avril Jean-Baptiste Jones. I'm the unit MWO, but in the Army, we say Sergeant Major. I'm also your relocation coordinator. And if I could give you any tips, don't try to save the CAF money. It's going to come out of your pocket. Thank you. You have to ask permission first, and then you get the approval to save money, and then you'll be good. Don't take it on your own and try to save money. It's a bad thing. Thank you, and welcome to Colorado Springs.
Hey, good afternoon, everyone. My name is Captain Johan Kim. I'm the controller of CANELEMNORAD. I'm also the section head for the FSS team. So who are we? I have a team of 7 people, including myself. So I'm the controller. We have Sergeant Peters, Master Corporal Gagnon Robitaille. We have Master Corporal Peters. We have Corporal Card, Corporal Blusen, and Aviator Manigat. To be advised, we had 85% of the team arrive to Colorado Springs this fiscal year. So everyone's new, but I have very capable FSAs. So Your claims will be processed in due time. Right, next slide, please. So where are we located? Basically, CFSU building. If you guys don't know where CFSU building is by now, think either CEO of CFSU has to have a conversation with you guys. It's basically building 365 beside the big MLP that we go on Thursday for MES. Next slide. So what we do, we basically do claims. 80% of the time, you guys will reach out to us for claims related questions. The rest, 15%, are the travel approvals, and the 5% will reach directly out to myself with regards to budgets and fin management. We also have a cashier, which is part of what we call RDAO, Regional Department Accounting Office. So we do process claims in-house, we pay to the members. So this is the FSS SharePoint website. Captain Rogalski would put this on our SharePoint, which has a link to it. It actually has a lot of SOPs and good information in there. And we are looking to update all the SOPs, and we are looking to actually do a video version of the SOPs just for the people that doesn't like to read 4 different pages of SOPs. So it'll be a video versions of how to submit TDR, how to submit utility claims, and whatnot going forward. Right, next slide. So Master Corporal Peters will go into details about what kind of claims that we actually process. Over to you.
Hello, everyone. I'm Master Corporal Peters, IC of the claims section here at CFSU. So we're going to get started right off with the medical dental claims. There's 2 primary services that we have regarding the medical dental. The first is if you have any large bills with your dependents, like if, say, your spouse gives birth, you can request a medical advance from us, where we can give you the money you need to pay the bill while you wait for MSH to catch up and reimburse you properly. The second portion is excess dental. For spouses, when they go to dental clinics off base, they can claim primarily with TRICARE and then later claim through Canada Life. The problem with Canada Life is they don't cover the entire bill. There'll be a section for excess dental. It's about 20% of the bill that you'll have to pay on your own, but then you can come to us with that invoice and we will reimburse you that amount. We have an example of the form that you'll need. That highlighted one on the right, just that little excess dental expense, that's the amount that we reimburse. And just be aware you need to have this form to bring to us. We know exactly how much that amount is. We can just go to the next slide. So the primary expectations, members within Colorado Springs are expected to initiate their own TDRs, which is the temporary duty request. It's the app that we use. It's similar to an ITA. It's just to get that initial authorization for travel. Members will be required to initiate their own claims through ClaimsX and also book their own travel through the HRG Neo app. Once you initiate your TDR and it comes to the travel approval section, we'll put your TAN within the comment section on the transmittal list, so you can find it there to book your travel at that point. So in the TDR application, it's a little more involved than a regular ITA. It has a little more details within it. It has a lot more details on the member. It has a little more details on what kinds of travel or what kinds of expenses there will be within the travel. And then it'll have the full transmittal list, since the transmittal list here is a little more in depth than what's normally required on ITA. There's a few more steps that it'll have to go through for approval. Okay, so with the GPT travel app, we've recently switched over to the GPT Neo app. It's visually very similar to the HRG app. The one major difference is that you can no longer rent a rental car off of the TAN. It'll come off of your credit card. Not sure why they made that change. We'll pass it off to Master Corporal Gagnon Robitaille for the delegation of authority section.
All right, so I'm Master Corporal Gagnon Robitaille. I am the fin management of CFSU FSS. So primarily I'm going to talk about delegations of authorities. So basically, when you get into a new position, some of your positions will require a delegation of authority. So you can section 32 on ClaimsX for your members, or approve purchases for your section. So basically, for executives and military equivalents, usually RC managers, will require to do the core 250, 451, and 152 on CSPS once, and then you have to do the assessment for executives every 5 years. I keep a tracking of every time you do the courses. I will let you know usually 3 months in advance that you have to that you require to redo that course. And then for RC admins, I know we don't have any procurement contracting officers, but also for payment officers and clerks, both courses 250 and 451 is required, and you have to redo them every 5 years. And so as of now, your EMC, EMC section 32, 33, 34 from, what is it, DLN Learn. It is still valid until expiry of your courses. So just keep that in mind. And that EMC will also be the equivalent for 152. But you're still required to do core 254, even though your EMC is still active.
So with regards to the DOA, if you guys are in need of a DOA, please come talk to me or Master Corporal Ganyan Robitaille. Check your MPRR to see if you have most up-to-date courses, and then we'll let you know if you need to do additional courses. With regards to the claim, I know everyone is anxiously waiting for the claims to be paid after you submit them. The normal time frame is 2 to 3 weeks. So if you haven't heard anything from us within 2 to 3 weeks, please reach out to us. We have plus boxes for every type of claim. And if you do, and we'll get back to you. Any questions about anything FSS related, sir? So partially, yes. So TDR, there's two sides of the house. So there's a funding piece and there's also authorization piece. So even though the fin code that we use is from outside the organization, we would still require a TDR. Any further questions? Right, that is it for FSS. Thank you.
Thanks, FSS. We're rolling along real quick here, so we're just going to keep on going. Next, we have the EAD with Sergio Rivas. Come on up.
Good afternoon. My name is Sergio Rivas. I'm the administrative assistant at CFSU and your point of contact for everything that entails employment authorization documents and social security numbers in order for your dependents to obtain gainful employment while during their posting here in the United States. Next slide, please. So we'll go ahead and cover various points here, beginning with who can work in the United States, employment authorization documents, so social security numbers, which documents are required, the basic process, the expected processing time, tax obligations. We'll have my contact information toward the end and take hopefully a couple of general questions regarding the subject. All of your dependents are eligible to obtain employment authorization documents during the posting here in the United States, including dependents that are 21 and over, but must be enrolled in secondary educational courses. You can even have children between the ages of 13 and 15, but must have a job offer in hand from an entity within the local states and a certificate of labor from the corresponding state's labor department. Unmarried children with disabilities and supporting a letter from a physician within the last 6 months, and all should have a NATO 2 visa, which the very vast majority of you do. The EAD allows applicable dependents the ability to apply for EA from Service Canada. I am not very knowledgeable on employment insurance from the Canadian side, so I do count on dependents providing me a little bit of information, but I do know that you do need to have the EAD on hand in order to even begin the process. You are unable to begin the employment insurance process without having the U.S. employment authorization document. And you may find scenarios where maybe the member of course, will not have an EAD, but you have requirement for services such as a cell phone or an internet service that does require you to have a social security number. You're still able to get a social security number through the administration as a first-time applicant without having to process the EAD information. And the same applies for spouses. If you're in the scenario where you do not wish to have employment during your tenure here, but wish to obtain a social security number, you can do so through the Social Security Administration. You don't require my support on that, but you're more than welcome to answer or ask me any questions. What you'll need for that process is basically your posting message from the CAF member, visas, passports, and all of the usual documents that you present here in the States. So in order to have employment, you cannot do so without having an EAD or a Social Security card, which is what I can assist you with. Working remotely in the States still requires you to have an employment authorization document. The only instance where you do not require an EAD is when you are reporting or working directly with the government of Canada or any aspect of their entities. These are just examples of what the EAD document looked like on the left-hand side and the Social Security card. The basic process is to engage my person initially. There's several U.S. government agencies that are involved in this process, beginning with the Department of State, the Office of Foreign Missions, Department of Homeland Security, and U.S. Customs and Immigration Services. We'll have an exchange of information where I'll send over an additional information document asking for all of the information for the CAF member and every single dependent that has arrived in the U.S. with the CAF member, regardless of whether or not, for example, a younger child is going to have employment. All of that information needs to be reported into the Department of State, where they'll assign a personal identification number that will then in turn be placed on various forms. In short, though, your visas, passports, posting message is everything that you'll require that you'll have already on your end. And then there will be two forms from the US government side that will just require the same personal information, arrival information, and the personal identification document. The reason I'm involved is there's endorsement from the government of Canada saying that you're a valid Canadian Armed Forces member, and that in turn waives fees that are related to this process for the general populace of EAD applicants. Currently, we're looking at 3 to 6 weeks, usually a little bit less. You folks will be happy to learn that the folks that came before you were looking at 9 to 12 weeks previously. Where the relevant offices have now pushed this into an electronic process rather than me receiving hard copy documents, mailing them out, and then you folks waiting. The initial EAD is valid for 3 years, and you are able to renew that within 108 days of expiration, and the renewed EAD will be valid through the end of your posting. You do have to file U.S. taxes while you're in the States if you have an EAD and you're receiving income from any entity here. We are unable to provide you any tax advice. There's a lot of questions regarding the non-resident portion of the taxes, but I can give you some direction on where to read on that. But taxes definitely need to be filed. Here's my contact information. If anybody wishes to take it down, I'll be around in the room if anybody wishes to approach me otherwise. But if there's any questions, I'd be happy to answer for you. All right. Thank you folks for your time.
So we don't have our next presenter just yet since we've got ahead of schedule, but MFS is going to fill in for this time slot and we'll just go accordingly. So welcome to our MFS team, Jill and Talia.
All right. I'm Jill Gorolev. I'm one of the community service providers here for MFS. Both Talia and I just moved here as well as all of you. So we are learning the role as well as trying to help you through this. So welcome to the portion of the MFS US Welcome Brief for Colorado Springs. MFS stands for Military Family Services. Whether or not you're new to the area or you've been here for a while, we're here to ensure you have all the information and support you need to make your time here as smooth and enjoyable as possible. So today we're going to give you an overview of the key services and resources available to military members as well as their spouses and dependents.
Okay, so fortunately, Jill and I both come from a background that is related to MFS. So we do have like a solid head on our shoulders moving into this role, but it is a learning curve for us. So never hesitate to come to us with a question. Never hesitate to come to us with a concern. We'll do our best to dig up the information that you need. It just might take more than the 10 minutes you'd like, maybe 1 or 2 business days, depending on which day of the week it is. So MFS as a whole offers targeted support for every stage of your posting, whether that's coming into the US or leaving the US and going back to Canada. So we offer relocation support that looks like this, welcome briefs, us attending the welcome barbecue, making our faces known and familiar and making sure you're comfortable with us. Employment navigation, if you haven't already heard of it, we have Career Coach Plus, which is career coaching, counseling, mentoring, as well as career fairs, which can be very beneficial if you're on a job hunt. I'm still learning what that means in the United States and what kind of opportunities there are for us to help you with employment here, but I'm sure there's something. Healthcare navigation, also something we're learning with TRICARE, TriWest, and now Humana, I guess is something else we need to dip our toes into understanding, but we're definitely here to help you figure it out along the way. And then community engagement. And I think that piece is probably one of the most vital parts of what we do. We offer, community integration in the sense that if you're wondering about something and whether or not it exists within our community in Colorado Springs, you can come to us and we can likely help you find a resource, as well as opportunities to get together with people from your community, such as coffee connections, and then attending all of the other events that go on in town through our CAF groups, which if you haven't found them on Facebook, I highly recommend you go and do a little personal research to connect yourself with those groups. And then we have child, youth, and parenting support, which can be babysitting courses, stay-along courses that are offered online, as well as quarterly wellness kits. Most recently, we sent out a connection kit, so that would look like something that comes in the mail and is a step-by-step sort of at-home program you can do with your kids or spouse or other family members to help you feel more connected, but they change quarterly. And then financial resources, which is something that we've both asked and that lots of people ask about, so taxes in the States and things like that. Neither of us are accountants, but we're excited to share that CISIP is working actively on new supports for cross-border financial information. So we hope to see a rollout related to that coming in the near-ish future without any dates to give. But hopefully that'll offer some more information about what it means to do taxes and stuff like that while you're living in the States. So if it's not clear, basically everything we do is designed to make your life here easier, most specifically for your spouses and your children.
Went too far. All right, so we have a number of different partners nationally and locally that help us meet the full range of CAF family needs during a U.S. posting. And when I say CAF family needs, I mean the CAF member themselves or their spouse, or dependents. Nationally, we are supported by CFMWS, the Canadian Forces Morale and Wellness Services, where we collaborate with personnel support programs, MFS education team, as well as CISIP. Like Talia was saying, we can help provide career education and financial resources. So locally, we have connections with the chain of command, as well as the family readiness centers here on base. And there are military and family life consultants that we can refer you to here on base. And we try to help ensure you have access to the healthcare navigation. Like we all saw this morning, it's a difficult process. We will can help provide different employment support and other day-to-day needs. So we have many different partners throughout nationally as well as locally.
So our partners over in healthcare services already gave mention to Marion Hall. She is the registered social worker who works for MFS in supporting military families, specifically spouses and children. So this is a confidential trauma-informed counseling service available for free to CAF family members. She offers all of her sessions over video or phone and is tailored to your family needs. CAF members themselves, if you're not already familiar, can access counseling services through the Canadian Forces Member Assistance Program. That's CFMAP, and that's completely confidential, off your personnel record counseling services. So if you are in crisis and want some assistance off the record, that would be who you'd reach out to. There's a 1-800 number available online for that. You can also reach them through the family information line here. But Marion exists solely for the purpose of supporting spouses and children and family members.
All right, so you have already heard about all of these things already, so I'll keep this part brief. We just heard from Sergio about the spousal employment. We have a slightly more information about EI benefits cross-border, so you can come to us and ask other questions about that. And we will have all of the PowerPoints from today, and so we can help other people if you want to refer anyone to us that have issues navigating the healthcare system as well. Yeah, so our goal is basically to help you resolve any of these challenges that you may have. You can come to us, and if you don't know where to go, and part of our job is to refer you to the right resources.
And now the exciting stuff that everybody really likes to talk to us about, be local services. So I'd say like the most exciting part about mine and Jill's job is that we get to work and spend time exploring what exists within our community, both on base and off of base, that might be helpful or useful to all of you, as well as your families if you have them here. So some of the big ones right on base here that you did hear about today would be the DEERS ID office. So they handle all of your ID cards and CACs so that you're able to have military access, as well as have that military ID card for military discounts. And that's super important in this area, especially because those exist almost everywhere. And then the Military and Family Readiness Center, close to the MFRC in Canada. They provide relocation assistance, job counseling, personal finance guidance, as well as programs like the Exceptional Family Member Program. So that program especially I'd like to highlight for 2 seconds. If you do have children in your life who have exceptional abilities, that program is fantastic. Endless resource bucket for families who need that sort of support. And this is all in one place, fully accessible to Canadians. Jill actually had a chance to go over there yesterday, and apparently they're just phenomenal. And then there's also the Outdoor Recreation Office. If you haven't heard of them already, you can rent a camper, kayak, a paddleboard, just about any piece of outdoor equipment you can possibly fathom exists in that place for an incredibly low price. So if you don't want to fully financially commit to the outdoor lifestyle in Colorado, but would like to rent it occasionally, that is the place to go. There's one at USAFA as well as one right here at Peterson. So depending where you live, I have used the service and rented a camper. It was super convenient. Propane tank was full. It was about as ideal as it could possibly be. So all of these services are definitely designed to support your family and help you make the most of your time here. Colorado's beautiful as it is, so having the accessibility to get outside as well is great. So consider stopping into those places.
Just a couple other things on base here. If you haven't been to the commissary, you can go there and get grocery. It's the grocery store with slightly lower prices for military members. You can also go to their website and order online and then pick it up later on that day. So if you want to, over your lunch break, go online, order some groceries, and then as soon as you're done working, you can go there and pick it up. The base exchange, separate from the commissary, separate in the same building, but separate entrances. They just have tax-free shopping for just regular household items and goods. The fitness center, if you haven't checked it out already, it's huge, 2 floors, weights, cardio equipment, indoor track, basketball, squash courts. Right next to that, there is the aquatic center, which unfortunately has slightly reduced hours right now and is only open for adult lane swim. We have the hours that they're open for that on our table in the back, in case that's something that you guys would be interested in. So there are a wealth of resources and services that are available here, and we encourage you to check them out.
Now, local services that exist that are not related to the base or either base. Military discounts are everywhere if you haven't noticed already. If you have your card with you, always ask. I've found that if it's not 5%, it's 15%. At places like King Super, which I called King Scooper for 2 months before anybody corrected me on. King Super, as well as Safeway, both provide a 10% discount on the 1st and 15th of the month for all military members. So take advantage of that for sure. Whether you're a spouse, a dependent, or a member, just have that card with you. As well as places like Shields and Dick's Sporting Goods. All of those places offer military discounts of varying percentages. The library in Colorado Springs is free to anybody who lives in the area. So just pop into a library with your ID card, get a free library pass, and you can rent everything from movies to audiobooks to physical copy books. I would recommend checking out the Best of the Springs website. I realize I'm rattling off information to you. There are notes attached to this PowerPoint. So when it goes out, you can scroll through the notes section and get the actual link to all of these websites. But Best of the Springs is really cool. It's a website that collects a survey from all of Colorado Springs once a year and provides reviews for every service you can possibly imagine. Mini golf, hairdressers, best place to buy sporting goods, that sort of thing. So ranked by the community and then delivered in a public format. There's also all of the CAF Colorado community Facebook pages. Those are locally led initiatives led by other Canadians. So everything from hiking groups to book clubs. And then I'm sure everybody's heard about this because we love to share. It's such a great deal. The Epic Pass for skiing. I think there's like 40 resorts in like a 6-hour radius here where you can go skiing. It's like $190 or something ridiculous like that for a year-long pass. If you have kids and you're not sure you want to spend that amount of money on them, all children, grades kindergarten to 5th grade, access every resort for free 4 times. So you don't even really need to buy them a pass unless you think you're going to be skiing every single weekend. Just get onto that Epic Pass website and check that out. And the last one is relocate to Colorado Springs. We do have a little handout for this out at the back table, but it's a resource that basically says, hey, you're relocating to Colorado Springs, whether you're military or civilian member just moving to the area. Here are all the things you want to know: doctors, shopping, malls, doctor's offices, and stuff like that. I think I said that twice. It's clearly on my mind with all this TRICARE business. Yeah, that touches on the surface. It's really a community of abundance in terms of resources and what's available to us. So I would suggest taking advantage of it while we're here. Yeah.
All right, this is our contact page. The first website that's up there is where you can go to learn all about the CFMWS things in the United States. From there, you can access the OUTCAN healthcare website that was up on the screen earlier during the presentation. So that's kind of like a central hub for like resources for anyone living in the US. You can also follow the Facebook page. The CFMWS shares local events, workshops, news. If you prefer an email, you can subscribe to our newsletter, which will be updated events and resources that will be, some are nationally and then some are the things that are just happening here locally. You can either come and see Talia and I in the office, or give us a phone call or email us. And basically that concludes our briefing. We are lucky enough today to have Angie Thibodeau, our Associate Director of OUTCAN, here with us, as well as Michelle Darrell, the Program Manager. So if you guys have any questions that we can't answer, maybe they could help us as well. So if anybody has any questions for us. Yes. Oui, on parle français aussi. Et si vous avez des questions en français, vous pouvez toujours venir nous voir. Ouais. D'autres questions?
One tiny footnote. In Moose Jaw, the MFRC was the coffee hub of the base. It's where everybody stopped all the time if for a social break. We would love for that to be a thing. And right now, CFSU is working on turning that Maple Leaf Pavilion, sorry if that's not what it's called, that's what I keep calling it in my head, into like a gathering space. So if you are in the area, please pop by. We do have a Keurig machine. We will upgrade someday, but it's great as it is. Yeah. And we just love to meet more people. So feel free to pop by. Okay, to answer the question that was just asked over Teams, it was mentioned that one of the Dick's Sporting Goods didn't have a military discount. I've been to two in Colorado Springs and they both have, and it's 5%. I just had to present my military ID. I am not sure about if it's location specific. That's a surprise, but it's something for me to find out. So I'll figure that out and post something about it.
Thank you. Thanks to the whole MFS team for being here with us today. Next, we have Lieutenant Commander Jones, the VPMC of the mess, to give you some deets about that.
Hi, so Lieutenant Commander Patrick Jones. I'm the VPMC. I am not Warrant Ivan Corinne, who is the actual PMC. We'll get there. He's out. It's me. So we'll go to the next slide, please. Go. So here is the mess committee as kind of broken down. We have a few members who need to be confirmed and voted in, but for the most part, it's pretty well laid out as you see here. That being said, if you want to join the committee or be a part of it or be an OPI, please step forward. We're always happy to take more people and utilize the experience of those in the room. So any questions on any of those particular topics, those are the best points of contact to reach out to in terms of entertainment or sports or whatever. Talk to them first. If not, you can always reach out to Warrant Corinne or myself. We'll get you in contact with the correct people. Mess dues. Yes, we do pay mess dues here. We try to keep them as reasonable as possible. We're doing really well in terms of the mess's budget at this point in time, thanks to the dues that we have. But this also means that we get to put on a whole lot of pretty good activities for the mess members. So this is where we're sitting right now. Any questions on that? Should be fairly straightforward. We've been paying dues for a long time, right? Next slide. So events. Standard, we do TGITs at least twice a month or as often as we are able to. In past events that we've had so far, we've got mess dining ins depending on the season and who wants to organize them. The last one we did was a mess dinner for the Battle of the Atlantic. So not just Air Force stuff, but we will also try to incorporate other services as well. Canada Day, whitewater rafting, golf tournaments, welcome barbecues, Pikes Peak Ascent, any other ideas that anybody has, please bring them forward. We will soon have a template that we will be able to issue out to the mess membership. If you have ideas, if you've got something you want to try out, bring it forward. No problem. We'll try to take a look at it and see what's the most appropriate action there. Next slide. So upcoming Oktoberfest. I don't know if you've seen the emails on this yet, but reach out to Lieutenant Commander Lee Chiriza for tickets on that. Promises to be a pretty good one. Remembrance Day, holiday parties. We have a children's holiday party and then a more appropriate adult holiday party depending on which one you fit into. We do follow the at-homes, and we are looking for an OPI for Winterfest, as well as a location. There's a lot to open up on that one, open to ideas. And our next GMM is not on the November 20th. It actually will be October 23rd. So those emails should go out shortly with details on that. But we hope to have some details, at least agenda type items in advance so that you can come prepared for those types of things. They're a bit hard to get to for people on watch sometimes. So we do our best to try to have as much advance notice as possible so that we can get a quorum on the go for any mess kind of activities. Next slide. I can't speak to this too well, but yes, we do have access to duty free. Oh, right there. Perfect.
Good afternoon, everybody. I am Major Alex Townsend. I'm the duty free officer for us here at Colorado Springs. Duty free is kind of a lesser known, unless you know about it, and then everybody. It's kind of a really cool benefit we have outside the country. Those of you who've worked Americans back in Canada, they do a little different. Get a car, they so many ounces of alcohol a month. They just go to the and they'll see we do things a little different. So we deal with a distributor, Kerosam, handles like cruise ships, foreign, other, like, for example, he was just here visiting last week, talked about Romanian embassy, American embassy. So he deals with a lot of the embassies and stuff as well. And they provide us a list of items that we can purchase. Duty-free liquor, tobacco, fragrances, and cosmetics. We've never had anybody order fragrances or cosmetics, but it is available. What we carry in our duty-free shops, put your hands up if you don't know where we're located. Cool, so we're located at the CFSU, right in between where supply is and the orderly room proper. So we're right in there in a little closet, we'll call it. So what we keep on stock is we keep spirits, limited wine, and limited champagne. For the members, you can go on the Microsoft Teams page. Duty Free has its own page, and you can see what we have in stock. We'll also post on there when we put out our next order. We're open every TGIT, unless there's three of us. There's myself, Major Luke Como, and Captain Chris Dubé. We all work in Building 2, but between the three of us, we work that there's always going to be one person there for TGIT, barring something that happens in the building, and then we'll let everybody know if we're not going to be there. Pay two ways. I'll foot stomp a quittance roll. Just makes it easier for me. But we can also do cash, which is fine. We carry a bit of a float for change and stuff. But a quittance roll just comes off your pay. Once we fill up the AR, we'll submit it that time. We do work with the finance folks to watch the exchange rate. So we do look and try to help you guys out that if we notice the exchange rate is fairly good, we'll submit that as soon as we get it. If not, we might wait for a couple days or a week and submit it when it's more advantageous. But our prices are duty free. So higher end stuff is where the bigger savings are. So if you're a high end scotch, champagne, fancy wine, that's where the real savings are. If you're just coming over to get a bottle of, like, I don't know, Bacardi white rum, the savings are going to be much lower than you would find. So for convenience, if you're have people coming over on a Friday night, you're way better going to Target, or sorry, not Target for beer, I guess, but Sam's Club or Costco, or even your local liquor store, and those prices will be close. We'll still be a little bit under. You will see some, like, for example, my favorite liquor store, Colorado, had to buy 1,000 cases of Buffalo Trace, so they offer it basically under MSRP, and that's so they can get access to what we call allocated type stuff, higher end bourbons and stuff. So every now and then you'll see somebody, because they can do sales down here, you'll see that they might be a little bit cheaper than us, but largely we are going to be cheaper than liquor stores, and lower end stuff not as much. Also, I forgot to mention for availability, for those of you on crew or just weird working hours, we will work with you to be open. So if you're a crew person and you're available, like you can't get in before or after, we'll meet you. If you send us an email or call us and go, hey, can you meet me before or after my shift on Wednesday? We'll come in and meet you. At Christmas, I will say we are typically open almost every day before Christmas, because for those of you new to OUTCAN, you're probably going to be requested by your peers or your neighbors to make moose milk. So we tend to try to open almost every day leading up to Christmas so people can have access. Again, we are a benefit for you. We only open on TGITs because that's why we're there. But outside those hours, we will work with you to make sure you guys can get it. All right, so orders. Twice a year, we send out an order to our supplier. Roughly May and November, we're just putting it together for the next one. We get a list of what they have available. It's called the Super Saver. I'll put an email out that goes through the CO and goes out to the membership that says, hey, here's the Super Saver. If you want to order something, you can order something. So if you want to order a case of wine, because we don't bring in much wine, the reason why we don't, we've had situations in the past where it goes bad or people don't like the selection we have. Order wine, highly recommend you order a case. So the way that works though, like I said, we'll send the email out, wine you need to order a case. If you want something that's in the list that we can't sell. So we try to keep a pretty, for those of you who've actually been in there, a pretty wide selection that appeases the entire membership because we don't want to bring stuff nobody's going to buy. So if you want to get like some weird, let's say, champagne that nobody else is going to buy, if it's over $75, we'll bring in one. If you're like, hey, I really like a bottle of X, Y, and Z, rum, rye, scotch, bourbon, whatever it is, we'll bring in one bottle. If it's less than $75, you got to order a case just because if it's something we can't sell, we mark up like $1 a case for spillage, things like Bailey's. If people order too much in the past, we sometimes have to get rid of stuff, or if there's something breaks in the lockup or something, we don't have very little markup. So because that's less than $75, we ask you to buy a case. However, for example, the last order we did, we had a member wanted to bring in a Highland Park 12 Scotch. Less than $75 a bottle, but we're like, we can sell this. And so we're like, you know what? We'll bring in a case, you buy your one bottle and we'll sell it. So if it's something that we can sell, we are flexible. If you want something in the membership, we think we can sell it, we'll bring it in. But primarily less than 75, you have to order a case, more than 75, single bottles. That's kind of the gist of it. Questions? I had no idea until somebody actually read the Super Saver last time and actually said, hey, we can get perfume. Can you bring some in? Yeah. Yeah, I think it's watches from when I looked last time, but I'll find out. So if there's something you're looking for, I will tell you, when you see the email goes out, it'll link to the Teams page and there'll be a spreadsheet to put in your info. There's a list in there, one of the sheets in that you can request things not on the list. Here's my thing. Do not ask for maple whiskey. And not get maple whiskey. Probably not going to get Blanton's unless he managed to get some and send us to it. Sorry, call. But he is working with us because we thought we were small potatoes based on his work with the cruise ships. But some of the other embassies, and they're ordering like a couple $100 in order. So he said he'll work with us, and he likes us, so he's a pretty nice guy. No maple whiskey. The other thing is if there's something really small batch, like some small gin from Canada, for example, if it's not distributed internationally, he's likely not going to get it. Same thing with a European, like some sort of spirit. If it's something really small batch that doesn't go all over the world, probably can't get it. Don't ask for maple whiskey. Other stuff you can ask for, but if you know it's small batch, I can almost 99% tell you he can't get it. But if it's not in the list, you can still ask. For example, one of the members asked for Crown Northern Harvest. It wasn't on the list, and he said, yeah, I can get you some of that. So also to the not on the list, if it's something, he sends it to us from Baltimore. If it's something you ask for when this list goes out that he has at one of his other warehouses, it's a 3-week turnaround. So unless you let us know well in advance, we're probably going to save that for the next order, especially the spring order, the APS order, because some people going back like to order some stuff and we don't want to delay the order. Or if it's going to put it past Christmas for those of you who have family coming or stuff you want for Christmas, like special wine or champagne, we will request that it go in the next order unless you give us enough lead time. Any other questions? There are cigars in that list. Nobody's ordered them yet. Only a couple people have ordered cigarettes. It's mostly US. I mean, you can get some European, no Canadian cigarettes. You'll see the list. They're not in there. Actually, this list might have some, but you can look in the list. They'll be in there. And if not, just ask, put it in. You'll see the spreadsheet's pretty laid out. The instructions are pretty simple. In that last page, things you can't see in the list, you can ask. Other questions? Sweet. I'm found both DWAN, Nipper, Sipper. My phone number's in there. Reach out anytime. And we're more than willing to work with you guys, even to come in to get you access. One other thing, you cannot sell to your neighbors. We cannot have your American compatriots come purchase from us. You are not supposed to share with them the price of the items in our duty free. If you were to buy a bottle, what you do after it as a gift is up to you. However, now, reason why is we don't want to be the ones, and some of the OUTCAN duty frees have lost that benefit. They've closed them down for things selling to non-Canadians. Selling to, for example, somebody comes down from Canada who's not OUTCAN and goes, hey, can I just buy a bottle here before I go home? Can't do it. We can support, for those of you who know people up in Buckley, we do have an arrangement because we have access to their acquaintance roll and stuff. We can help them out. Somebody's here from Vandenberg visiting you in one of your other sort of jobs, we can help them out because they're OUTCAN. Family members are entitled. Yeah, that's a big stomping point. We try to be hard to be the people not to ruin this for you guys. So we ask you to work with us. Make sure you're not the example why we close it duty free. No questions? That's all good. Thanks very much and welcome to Colorado.
Awesome, thank you. And Warrant Karen posted on the group that said we have a volunteer for Winterfest and for the Super Bowl. So you got your volunteers, sir. Yeah, awesome. Thanks for that. Next, we're going to have Major Durenzi come and speak to us about public affairs, and then we'll take a little break.
Okay, so you've probably done this a couple of times today, but what's roughly the composition of like operators in building 2, CFSU, support staff, and then family members here? Can't hear me? Oh, okay. It sounds loud to me. Are you mostly building 2? Okay, and then just family members, would you mind just saying hello? Okay, cool. Looks like a good group came out today. So yeah, Major Jenny Durenzi, I'm Public Affairs for NORAD, and also Public Affairs for the Canadian Element NORAD unit. So I'm gonna there's kind of 2 parts of my presentation. The first part is, it's more for information, just for some context of like what we spend the bulk of our time doing, but the second half of the presentation will be more focused on like Canadian Element NORAD support to this community. So yeah, we'll just roll right into it. This is just a funny meme that we always like to share because often public affairs is brought in at the 11th hour when we should have been probably rolled in earlier, but yeah, just a cute little break glass meme. So yeah, there's a lot of words on this slide, but in essence, the raison d'etre of public affairs is to inform the public in a timely, open, transparent manner what we're doing. We're distinct from 3-9. We're not info ops. We just want to increase the profile of the Canadian Armed Forces, the institution, represent Canada, and just provide everybody the 5 Ws. Yeah, you can see in order to enhance our assets, increase the public confidence, demonstrate our sovereignty, yeah, and help avoid escalation. The more informed people are often, just the better. So our team is comprised of 3 Canadians and 1 American. We all 3 of us Canadians got here last year. We showed up in APS 2025. First, yeah. All right, so here's the CAF PA within NORAD PA. So our team is in building 2. So if you walk in the main building entranceway and turn immediately to the right, and then immediately right again, that's our office. We are a combined public affairs team of NORAD and U.S. Northcom Public Affairs, and we work for a Marine Colonel Kelly Froschauer. We have again, sorry, some of this might be content you've already heard today, but tracking, there are 3 regional NORAD teams and they all have public affairs teams. So we work in concert with them. We emphasize that we're always telling the NORAD story when we're down here. So you don't distinguish Canadian and American. We talk about the binationality. So I've just kind of highlighted in bold some of the things that we spend a lot of time creating public affairs products for. Again, very operational focused, but so I don't want to linger here too long. So our team is responsible for putting out press releases if there's like an incursion, like an AEDIS incursion in the Arctic, the Alaskan NORAD region or the Canadian NORAD region. We put out information on that. There's a temporary flight restriction violation. We put out materials on that so the public has awareness of what's happened and what NORAD has done in response. So we spend a lot of time kind of in these areas. I don't think this is new to anybody except maybe the family members here don't maybe know some of the weeds of this stuff, but the FAA will put out notice to airmen and temporary flight restriction areas, and NORAD enforces them, and we talk about it and we explain what we're doing if a pilot violates it. Again, press releases. Okay, so I just wanted to spend a little bit of time here. Does this everybody here have an idea of NORAD Tracks Santa? Okay, so this is often when you talk to people about NORAD, they say, "Oh yeah, I know what that command does. It tracks Santa," and that can, yeah, it can be a little polarizing because a lot of operators get frustrated by that, but it's also for us kind of, yeah, it makes you smile. It's actually nice to take a break from all of that other stuff and just talk about something happy, Santa. And this program is huge. It helps us increase the profile of the command and what we do, 24/7, 365, but through like the lens of something really in the spirit of the holidays, and pulls a lot of people from the command together. So you can just see some stats here of how many people typically support it every year and just the reach that we have. Last year, our website had about 20 million visits. We get, I think the biggest year that we had callers call in was like 420,000 callers from across the world. So if you want to be involved in this, let us know, because the Public Affairs Office is the OPI for it. So it's this program takes up half, like it's something that we work on throughout the year, but the second half of November and then all of December, we're very in the weeds on this. So I don't know if you're interested in coming out to the call center, Hangar 123, at the end of the base where the airstrip is where the hangar transforms into like a mini North Pole. It's really beautiful, so much decor. Yeah, a lot of people come out, and if you wanted to sit and do a couple of hours of answering phone calls, you can be put on a shift to do 1, 2, 3 hours. If you want, your family can come out. If you want your kids to come out, excuse me, they just have to be 15, and they're welcome as well. And you're taking calls from all over the world, people asking, where's Santa right now? What time should I get in bed? It's really, really nice. So if you have the time on the 24th for 1 or 2 hours, please reach out and participate. It's great. Yeah, so we are also this year, just another sort of snapshot of some of the big lifts that we're just trying to increase the profile of the command throughout the year across the world. So is everybody aware of Mr. Beast? Yeah. So this was a big thing that we did this summer. We had Mr. Beast come to the mountain, and yeah, we've got an episode out. You could see General Radiff there. Yeah, so these are examples of us just working with kind of high profile news agencies and influencers. If you're curious to follow us, these are our platforms. It's at NORAD Command for both X and Facebook. Okay, so just sort of changing tack to CANELMNORAD. If your family members aren't here today, this is kind of like the good content to take home and discuss with your your spouse or your kids, because it just pertains to everybody here who's here on a NATO 2 visa. And I won't get too granular in the weeds on like the legal implications, because it's not really my lane, but because we're all here under the NATO 2 visa, and on behavior and appropriate representation of the D&D CAF while we're here, which sort of leaks into your personal lives, like your social media and so forth. So we'll take a minute to kind of go through this stuff together. And if you have any questions, you can either raise it with, if you're a family member, raise it with the CAF member in your house, and they can bring it forward to the chain of command. You know, they could talk to me, they could talk to my team, and we can just figure out if you need some assistance or need to maybe tweak what you're doing a little bit online. Yeah, before we get into that, so this is also support that we provide to the Canadian element. So speech, writing, imagery, and video support to our events and activities. Like we just had the Battle of Britain ceremony on Sunday, for example. So that's something that we would provide the imagery support to. And by speech writing, if anybody is assigned like as an action officer or an OPI where you have an event or an activity that requires remarks from the ND, reach out to our team and we can help you out with that. Whether it's a speech or bullet points, just reach out to us early. As soon as you have the information will help us. Yeah, so the same mandate that we have, you know, back home in Canada, supporting CAF membership across a wing or a base. When there are public facing engagements, how to use social media properly, if media queries come in, or there's any sort of incident that occurs that where this might provoke media interest or just spark public interest. Again, that's just good to think through the lens of, should I contact my chain of command to contact the public affairs team? Okay, so here's what I was mentioning a little bit earlier. I think all the CAF members in the room are familiar with these QRNOs and the DOD. Improper comments and just disclosure of information or opinion and permission to communicate. So for social media and personal use, the DOD 2008-8 series it applies to CAF and D&D members, but not dependents. So this is sort of that kind of weird space of being down here on a NATO visa and you know, subject to that SOFA. So the QRNOs for CAF members and the NATO SOFA include regulations regarding how to use social media, your personal social media, including on political items. So this extends into dependents, and this extends into like as well into like the teenagers in your home, or if you have 11, 12, 13-year-olds who are, you know, have their own profiles. So there was actually a really fantastic email that got tweaked, and I just borrowed snippets from it just to kind of pull out the key points here. So yeah, respecting the law, this is under the SOFA, respecting the law of the receiving state. It's our duty to abstain from activity inconsistent with the spirit of the agreement. So in particular, any political activity in the receiving state. So I always like characterize life down here as like a year's worth of news every week. It's pretty crazy. Like even just today, you think like we have the United Nations General Assembly that's going on. We just had the Charlie Kirk Memorial, and NORAD had a TFR set up for that, for example. So there's so much going on stateside for anybody working in building 2. While NORAD is like distinct from US Northcom, there's a lot of stuff going on the Northcom side that you know, just provokes like emotive reactions from people because it's dealing with people in the United States. So I won't get into it. I think you all know what I'm talking about. We just have to be very mindful of like staying apolitical and just at all times just putting through the lens of representing Canada here, representing the D&D CAF, and just to always be very mindful of that. So yeah, I've highlighted social media, and I don't think it'd probably be a good idea to go case by case and like, I just posted this, is this okay? Exercise your good judgment. If you're like in a space of like, oh, I actually have a lot of political content on my social right now, just give it a good look, give it a good scrub, and just think about it, and just be very mindful moving forward. Just think through that lens at all times. If I'm putting this up on my social, am I honoring the like part of me through the SOFA and the visa, which, you know, provides me access to live stateside for 2 or 3 or 4 years. Does this make sense? Yeah, and please don't hesitate to contact your chain of command if you're concerned that you're too late and then maybe something is up on your social that you shouldn't have put up, or same thing with one of your kids. I'm sorry, I don't want to stress everybody out about this, but I have 3 kids as well, and I'm thinking about it now too, because it's different now than it was before. I think raising kids, and yeah, just the enormity of what is available to them online and stuff that maybe you're not tracking all the time, or just like, oh, my friend put this up and I liked it, or I amplified it and I added this, and like, oh no, why'd you do that? Like, now we're in a tangle. So I would just encourage everybody to keep the conversation like alive and well in your homes. Yeah, pictures are worth 1,000 words sometimes, and I don't know. I just had even a recent incident with one of my kids. Actually, all 3 of my kids were just at a local park near our house, and they just got into kind of a nasty bullying situation really quickly, and it spun out of their control. And all of a sudden, one of the other kids from the other group was filming them all, and they came home quite upset. So it's weird times. Everybody is almost a journalist now, in the way that we all have access to cameras, we can live stream things, and before you know it, something really can ripple or snowball out of your control and have an enormous impact online that you had no idea or didn't see coming. So on that happy note, yeah, I hope it didn't scare you into just like freezing your Facebook and X and Instagram accounts for the next 3 years, but just think about this more. You just have to think about it more down here. And again, not really my area, but just sort of as like a parallel example, in the same way that, you know, use of cannabis, there's a certain application for that back home, and it, you know, dependents have some autonomy there to, you know, make some personal decisions, but it's not the same when we're down here. So we just always have to think about that visa, even though it's tempting at times to say, like, I'm Canadian, these issues don't apply to me. You know, I'm different from my American neighbor. Just always through, like, you got to think about every time when you pass the border, or if you're at the airport and you're establishing your what's it called? What's that thing you get at the air every time you cross? Thank you, your I-94. It's always on that visa, right? So it's why you're always using the green one. So if that's applicable at the border, then all of this extra stuff applies as well. So you just gotta maybe, if you have a proclivity to be like more political and more bent in a certain way toward like a political agenda, just bear this all in mind, and just always look through this lens of ultimately where that conversation could go. Does that make sense? Okay, did I stress everybody out? Sorry. I think that's my last one. Welcome again. And if you have questions for public affairs, I think you're all getting a copy of this slide. So I would suggest to just use the forces accounts, the D1 ones, instead of the other ones. And yeah, we're very happy to help you out. No questions? All right, thanks.
Oh, thank you. All right, well, hello, good afternoon, everyone. I'm Major Evan Foster. I'm your Canadian Element NORAD Provost Marshal. I typically go long with my presentations, so I'm going to be using some of my notes, my reading notes, so I can keep online with Taylor's schedule. So, how does this thing work? There we go. Sorry. There we go. So my role. So I'm down here as an advisor for policing and security for the U.S. and Canadian chains of command. I am not, and I want to stress this, I am not in a policing role while I'm OUTCAN. So I will act as the liaison with any security forces on the installation or the local police services off the installation if there is a requirement for that. And also I help facilitate access to the installation for any distinguished visitors and also into the specific buildings that require badges. Okay, so all incidents, accidents, or anything in relation to discipline, it's important that you inform your chain of command if any of this occurs, and this applies to you and your dependents. They need to know, essentially you need to know who to contact in the event of a situation so that they can properly take care of you or help with the situation. As the PO said earlier, we are subject to the status of forces agreement while we are down here. So I'm not going to reiterate that, but that essentially says that we are subject to the laws of the United States. Twice a year, typically, we're going to have off-limit areas published in the routine orders. These are areas that have been deemed unsavory for individuals. This list is established from Fort Carson, being the largest military installation in the area. So they generate this list based on a bunch of criterias, and then we just mirror that list and provide that to you so that you know to steer clear of these areas. It's either large occurrences of crime, drugs, violence, that sort of thing. So it's just for your safety and security for you and your dependents. Okay, the laws. So this is just an overview indicating that the laws are very different in the various states across the United States. Typically, you know, just on the graph here, you can see I want to bring to your attention the age of sexual consent differs from Canada, where it is 16 in Canada. Here it is 17. So if you have teenagers of that age, just be mindful that legally they cannot consent to sexual activity unless they are 17. Anything less than that, then they may be subject to being prosecuted for statutory rape. On the far right, you'll see what the base priorities, and just like military police back home, they will be enforcing laws on the installation property. So currently looking at speeding, seatbelts, cell phone use, and distracted driving. So do not use your cell phone on installation. Texting, unless it's hand-free, completely 100% hands-free. If not, you're going to be pulled over, you're going to be cited for that, and you could lose your driving privileges on the installation for up to 14 days minimum. Okay, cannabis, marijuana, simply put, none whatsoever down here while you're OUTCAN. It doesn't matter if, you know, it is legal in the state. It is not legal while you're here on an OUTCAN posting. This slide I just want to bring to your attention. Guns, and so this chart basically depicts the stats for the ownership in Colorado. So carrying a weapon is legal in many states. There is no requirement to register a firearm here in Colorado. So as you can see there, the average Colorado gun owner owns between 4 to 5 firearms. And of those that are registered, it equates to about 45%. So that number is more than likely much higher than that. I want to bring to your attention that if you do have dependents, if you've already had the talk with them about sex, drugs, alcohol, you should include guns. With firearms being predominant in the household for gun owners, it's very likely that your children may come across a firearm in a residence at one of their friends. So just please have that talk, let them know how to handle the situation if one is ever presented, and what to do and not to touch it. Moving to active shooter incidents, considering Colorado is not immune to active shooter situations. Chart depicts the stats over the last 3 years. The year to date was effective from early August. So it seems like it is trending down. However, they still do occur. Be mindful that when you are in a situation, just be mindful of your surroundings. If you feel uncomfortable, leave the situation. Like I said, or correction, I didn't say earlier, Colorado is a state that you can have open carry or concealed carry firearms. So it's not uncommon that you're going to be at the shopping center, grocery store, where you're going to see a firearm on someone's hip, packing groceries. It was a shock to me at the first instance of that. Check with your school district or your school, whichever district you're in, to find out what their policy is for active shooter instances at the school. They likely will have procedures on what to do should a lockdown occur or shelter in place occur. So please check with them. Okay, active shooter. So you may have received some training back in Canada on how to respond to an active shooter situation. Here, it's essentially no different. You have 3 options. It's run, hide, or fight. Your primary action is to run from the situation, get yourself to cover, concealment. If that is not a possibility, please find a hiding space. Typically, what you want to look for is a secure area, something where you can lock the door, with no windows. If there are windows, hopefully if there's blinds, you can draw the blinds. Get in there, stay quiet, turn off your phone. Yeah, just any sound, any light, any movement is just going to draw that aggressor potentially to your location. If you can't run or hide, the option is to fight and try to neutralize that threat as best you can, and using any means necessary. It's to save your life, to save the lives of somebody else if they are near you, and to neutralize that threat. Information security. Yeah, so there is an abundance of email that spam, spearing emails that you may receive, emails from Nairobian Prince asking for money, or you've just come across a big windfall. These are too good to be true. If it's too good to be true, it likely is. So just be mindful of the email links or attachments that you receive. If it's not from a known source, do not click on the link. Do not open the attachment. Please do not. There's a positional mailbox that you can forward these emails to help with suspected emails. So I can provide that later. Be mindful of what information you're sharing. Typically we overshare in this day and age, and all of our electronic devices that we use, Fitbits, smartwatches, they're all tracking your activity. So just be mindful of that. So you might want to consider how you've set up the device or what access it has to your personal details. For any computer system that you're using, just be mindful of if it's using the current version of software, antivirus operating system. It'll help with security updates. Don't put yourself in vulnerable positions that would leave you subject to any blackmail or extortion. Be mindful when you're at ATM machines or pay service, point of sales devices when you're tapping or inserting your chip. ATM card or credit card, just make sure it's a valid point of sales machine and not one that has a skimming device placed on top of it. And again, we're as D&D and CAF members, we're pretty familiar with changing our passwords. I also recommend that for home, just keeping strong passwords, and don't keep your passwords written underneath your keyboard or your mouse pad. So just be mindful that we're all subject to cybercrime. All right, this slide is more geared towards home life and if you have dependents. So just be mindful. You might want to consider setting up individual profiles on the computer system, giving access to, restricting access for your dependents, because depending on how you have your profile set up, they may have access to your online payment information. So unless you don't mind receiving bulk orders from Amazon for something that you didn't want, go ahead. And when you're buying and shopping online, just be mindful that you're using trusted sites. So do your due diligence, look at that. And gaming is something also to consider when you have dependents. That is a direct line for communicate with your dependents. So chat groups, first player games, whatever it is, if you don't have proper security set up on that profile, you have strangers talking to your children or potentially talking to your children. TikTok, Instagram, any social media challenges that might be floating around that your children might be peer pressured into, have that talk with them so that they are doing the right thing and being they don't put themselves in a situation that could harm them. Social media, PAO also talked about this. There's policy convergens, directives, orders that indicate how we should conduct ourselves online. This is just to remind you that everything that you put online is out there, will be out there forever, even though that you think that it's deleted, it can always be found. Okay, local hazards. So depending on where you've come from Canada, you will soon realize, or you've already realized that being here in Colorado Springs, we are at a higher elevation. So the effects of the sun is going to affect you a lot faster with the limited atmosphere. So with that, you're going to be subject to sunburns, severe weather involving hail, which is going to cause property damage, severe flooding. Colorado Springs is going to be a very distracted state, so be very mindful of that, which could lead to road rage incidences, or be very mindful of when you're traveling through intersections, because a lot of drivers do not stop at the red lights and they will run those reds. So just be looking left and right. And if you venture out into the environment, like I said, depending on where you are from, wherever you're being posted in from or from Canada, we're gonna have a lot more different wildlife down here. So rattlesnakes, mountain lions, black bears, mountain bighorn sheep are all gonna be possibly encountered. Travel restrictions. Okay, so in general, if you are going to travel on duty or personal travel, I recommend that you visit two sites. The first site being the Canadian site, available on Canada.ca. It gives you the travel advisories that are effective for that particular location, and then also the U.S. site at travel.state.gov. We should have all traveled here on our green passport, regardless of whatever passport you traveled on, depending on your situation. You should leave on this. You should exit the United States on the same passport. It affects the I-94, and because we're on an A02 visa, we're allowed to be here. If you enter in on your blue, then you're down here as a visitor. It's only valid for 180 days, causes problems. So if you go on travel, exit on the same passport. Hopefully it's going to be your green, and everything will be good. If not, and if you run into a problem, please engage with myself, and then I'll reach out to the Customs and Border agent, excuse me, to help work through that situation. Okay, notice of intent to travel. So it is required for all CAF D&D members going on duty travel to submit a notice of intent. It is recommended for whenever anybody travels on personal leave. There's two methods of doing that. You can do that through your leave pass or directly on the DGDS website. The Travel and Contact Security Program evaluates risk based on multiple criteria and on an ongoing basis. For that reason, if you are traveling to a country where TSC has information that may assist you, they will contact you for a pre-travel brief if it is required. If you don't receive if you don't receive any contact from them, then the pre-travel brief is not required. Those individuals that are working in Building 2 or are in possession of a green badge, there is a requirement for you to have a travel brief prior to travel. This was indicated when you when you received your green badge, but typically most people forget about that. So on the J2 NIPR site, you can find the actual country briefings, and you can just read through that. If you need to access that location or need to know where it is, can't find it, then please come see me. Okay, so getting access to the installation and ideas. So everybody should have a common access card, which is your CAC. This grants you access to the installation, also provides you other services such as TRICARE, prescription services, access to the PX and also the commissary. It's important that you attend the individual visitor centers to enable your privileges on your CAC for that installation. So while down here, we're able to access the other installations like Fort Carson, Schriever, Cheyenne Mountain, and USAFA for medical reasons. And so when you go to the visitor center to enable those privileges, indicate that you are there to enable those privileges for medical reasons. Depending on the individual behind the counter, they may, if you don't indicate that you're there for medical reasons to have your privileges enabled, they may give you a hard time and say that you're not permitted access, especially at USAFA. So with your CACs, these cards are required to be re-verified every 6 months by your MPI-CAM sponsor. Who's your MPI-CAM sponsor? Very good question. So depending on where you're located, it could either be Mr. Hales over at Building 350. And if you're in Building 2, it's more than likely your departmental security manager, so your U.S. security manager. Whoever you provided your Form 2586 to when you were done getting your building badge is more than likely your sponsor that it needs to re-verify. If they don't re-verify your CAC at the 6-month mark, you will lose your CAC will be revoked. It'll be inactive, and you will lose base access and any services that are related to it. So medical appointments, prescription, access to the installations, PX, commissary. It's a big headache. So please say your departmental, your MPI-CAM sponsor should be doing this, so you have no reason to worry. However, if you receive an email indicating that your CAC needs to be re-verified, it's likely that you're receiving that email a month prior to your CAC being expired. If you receive that email, reach out to your sponsor to verify that they are actually tracking your reactivation. And if you don't know who your sponsor is, and you can't determine that through your departmental security manager, come see me. NDI 20s. So everybody prior to being posted OUTCAN should have renewed their military ID. If for whatever reason you're cross-posted or extended and that military ID is going to expire, come see me and I will process you for a new ID. We don't issue temporary ID, so we'll go through the process of getting you a new ID. VCRs. So you may require to submit a VCR if you're visiting another installation, or if you're identified as an action officer and you're going to have visitors come to Peterson or anywhere in Peterson or Cheyenne Mountain. If that's the case, it's very important that you identify who the proper security and facility point of contacts are, and that you submit these VCRs in enough time to get processed. So typically it's anywhere from 35 to 45 days, depending on the level of the discussion and the locations that you're visiting. With that, there's going to be follow-on action that you will need to take to get your guests into particular buildings. So the VCR gets them access to the installation, but it does not get them access into the buildings. So if you have questions about that, please come see me. And then finally on security clearances, it's important that you clear in with your unit security supervisor, your Canadian unit security supervisor, to ensure that your web SCPS profile is transferred from your losing unit to here. If not, your security clearance could lapse, and then that just causes problems for everything else. All right, so being on the installation, just back in, like in Canada, the US takes security very serious. So they are performing security checks on a routine basis. And, you know, the US security orders may differ or are different from Canadian standards. So if you have any confusion or you just need to ask a question, reach out to your unit security supervisor, Canadian, or your departmental security manager, American member, to inquire. And if all else fails, come see me. So NORAD and US Northcom 101 training, that's going to be a requirement for all Canadian element NORAD working in Building 2. So that's going to be coordinated, booked through your security manager or your supervisor. So ensure that you try to get on one of those courses as soon as possible. And when receiving classified documents, be very mindful of the security markings. We work in a multinational environment here, so unless it says releasable to Canada or Five Eyes, you may not want to open that document if it's sent to you electronically. There have been several recent incidents of emails being sent to Canadians that are no foreign or were not releasable to Canada and are being opened. That is a security breach, causes big problems. So please be mindful of the security markings on any of the documents, and also when you're producing documents, make sure that you categorize it properly. So again, if you see no foreign, that's no foreign nationals. Five Eyes, it's the 5 nations, and then CEO is Canadian eyes only. These are just things that you may come across. And just to reiterate, Canadian element NORAD is a 100% shred, has a 100% shred policy. So just be mindful of that. If you're unsure on how to properly destroy of your material, refer to the NDSODs, refer to your US security manager or your departmental security manager, and they will tell you where the proper shredder is located. All right, these are just some of the frequent infractions that have occurred recently in Building 2 and around the base. Get in the habit of removing your tokens from your readers, and this includes your PKI card. Security checks are being conducted by the security guards, and they will seize those cards if found in the readers and leave you a note or another card indicating that it's been seized, and you will have to come and retrieve that, and a security incident will have to be raised. Leave your desk for any reason, lock your computer. Please ensure that safes, either the US version or the Canadian versions, are properly secured at the end of the day. Do your daily checks. Again, we talked about the improper destruction of classified material. And be mindful of when entering into a building. They likely have a MSEC policy in place. I know in building 2, 920, Cheyenne Mountain, just to name a few, you are not able to bring in personal electronic devices, medical devices, all these things, unless they're on an approved list, are not allowed in the building. So if you have a medical device or personal wearable device that is on the approved list, or you're not too sure, you have to submit a request to have that device reviewed. Reach out to your departmental security manager. They will assist with that, and depending on which location you're going in the building, it may be escalated up to the SSO, which is the Special Security Office, for anything entering into a SCIF. That's my contact information. I am located in building 2 on the 2nd floor in the Command Security Office, just past the 2 conference rooms. So please feel to reach out to me on any method of contact there. Questions? Sir. Yes. Okay, so I believe that there is something on the screening checklist that indicates that you have to have your NDI 20 valid for at least, correct me if I'm wrong, 1 year past your posting date. Yeah. So if your NDI 20 is going to expire within the next 6 months, please reach out to me and we'll get you processed. Any other questions? Great, thank you.
Awesome. Thanks, Major Foster. So next up, we're going to have, I don't know how to pronounce your name, sir. I am so sorry. There you go. Thank you. He's going to give a COMCO SCI presentation.
All right, so welcome to the unit COMCO brief. I'm Major Bez Alijanpour, your briefer and COMCO for the CANELEMNORAD, the unit COMCO for CANELEMNORAD. Here's actually, where's my clicker here? There we go. So here's a list of references applicable to the COMCO work that we do, mainly consisting of policy from the National Security Center, National Special Center, NSC, in Ottawa, which governs the administration of secure compartmentalized information, SCI, in DND and CAF. In the bottom, you have the positional mailbox for the COMCO team. I asked that all communication regarding COMCO has to go to this mailbox, not to myself or any of the individuals on the team. This is how we manage and prioritize activity and responses to avoid filling up individual mailboxes, which can often detract from main duties. So just a quick rundown of the main duties and responsibilities of the COMCO team. In a Canadian unit back in Canada, normally the SCIF or the SCIFs for that unit are under the custodianship of the COMCO and their team. However, here in the US, we don't own any SCIFs, but we do so our work revolves around a great deal of SCI administration activities for folks posting in every APS, dealing with out of APS SCI administration as well on a routine basis. That could be, for example, initial SCI applications, indoctrination, de-indoctrinations, you name it. We also do TS SCI security incident investigations, communication and coordination with NSC on a variety of topics, including implementing of policy and updates. So the COMCO answers to the CO and to NSC, the National Special Center in Ottawa. It's important to note that the COMCO, Deputy COMCO and SCI administrators or SCI admin are all secondary duties, and none of us are really doing this full time, even though it's quite a bit of work. The COMCO answers, oh, I mentioned that. So it's important to note, where are we here? Due to the nature of the unit here and the existence of various debts across the US that are also part of CANELEMNORAD, The amount of SCI admin and personnel we deal with is actually quite high. For example, this APS alone, we managed SCI for over 220 people so far, and that included people posted in, posted out, and those who are extending their posting. I'm not sure if there was a USS brief specifically, but I do believe you covered a lot of USS stuff in the previous brief that Major Foster just did. So it's important to understand that when it comes to your security access, if you will, there's really two parts to it. There's your security clearance, and then there's your SCI access, your caveats. Also, well, yeah, SCI. Clearance part is managed by the unit security supervisor, the USS. And where we step in, the COMCO is responsible for coordinating the SCI portion of your access. And this is where we differ from the USS. So similarly, for security incidents that are below the TS level, your USS is the responsible party for those investigations. However, when the incident occurs inside a SCIF, a secure compartmentalized information facility, or what you guys would know as a high security zone, that's where we get involved, especially if TSSCI material is involved. Either way, whether it's in a SCIF, if the incident takes place inside a SCIF or involves TSSCI, that's where the COMCO steps in. These are some of the main distinctions between COMCO and USS, because sometimes we often get requests that are USS related. So there are some distinctions between the USS and COMCO. Lastly, to point out, the COMCO team members are all trained and qualified per training prescribed by NSC, and the qual code is ALMG. Let's go to the next slide. So this is our org chart. I mentioned earlier that there are DETs across the US, and they're all part of CANELEMNORAD. And here they are in this org chart. You can see each unit. So for example, we got JBEAR, that's Joint Base Elmendorf Richardson in Alaska, for example, has a deputy COMCO. It says TBD, but it's actually occupied right now. Someone got posted in, a major who's actually a friend of mine, and she's the COMCO there. And Sergeant Dodds is their SCI admin, just to give you an example. So since it's difficult to manage SCI for every DET with a small team here, each DET has their own deputy COMCO, and in some cases, an SCI admin who look after their own personnel's SCI needs. For our team here in Colorado Springs, we have myself as your COMCO. We have Major Foster, who I don't think is, oh, there he is, who's one of my deputy COMCOs. We also have Captain Thompson, Natasha McNamara, who is over there. And we got our SCI admin, Master Corporal McLennan. So this slide just kind of shows a typical process from when we receive, when my team receives your screening message, like early in the year, like in February. And that's really when the COMCO process starts. And it really goes until later in the summer, or when that posting season ends, until the transmittal of clearance or TALK message is actually received by the U.S. Special Security Office, the SSO, who then is able to print your green badge for you. Those of you in the audience who already have access, and most of you should, and have that green badge, you've already gone through this process. So this might sound familiar to you. Some of you are probably waiting for your process at this point. The takeaway from this slide is that there's a lot of processing and forms involved, often taking time that is outside of our control. For example, this can happen when we are waiting for NSC to issue an authority to indock you, or when we are waiting for NSC to send a TALK message to the SSO to get you your green badge. So prior to authority to indock, that is not a good time in the process to ask our team to prioritize your file, unless you're part of a select group, such as the people in Tinker who go on the AWACS course, or certain folks here doing IQT, MQT. Those are currently the selected prioritized folks. We can certainly entertain, and we have some prioritizations outside of these select groups, but the caveat is we have to be told in advance, well ahead of time. For example, when a screening message is received early on, or when we start the initial paperwork, that's the best time to reach out to us and let us know that a particular member for reason XYZ has to be accelerated through the process. We also can't keep adding to the list of prioritizations indefinitely to NSC because NSC has a limited number of personnel and resources. And to do us the favor of accelerating files, we also have to be cognizant of how much we're pushing on them. And there's a limit to how much we can exercise that option. So in a nutshell, while we are on top of everything, any delays in the process are at stages that is at NSC's level. And in some cases, it's at DGDS's level for investigations for initial or renewal of your SCI and are otherwise outside of our control. So we ask that folks who are waiting for authority to undock or their talk message to get the green badge to be patient with the COMCO team. So SCIF access security policy. So I'll just give you a few minutes to read through this, and then I'll carry on with my notes. So the key takeaway here is that you must all at all times abide by the rules and prohibitions of a SCIF. Typical errors include, and I think this was mentioned in the previous brief, is forgetting, for example, to remove an electronic device like a smartwatch before entering the SCIF. Unfortunately, coming into the SCIF with a prohibited or unapproved electronic device does constitute an SCI security incident, and we'd have to investigate it. In Canada, almost all SCIFs prohibit any electronic device on smartwatches except approved medical devices. However, the SCIFs here for NORAD Northcom do allow, there's a list of certain smartwatches that are allowed. However, the caveat is those watches have to be brought into the SSO's office, inspected, you have to fill out a form, and once approved and that form is filled, and you have to carry that, there's a little card that comes with the form that you have to technically carry with you at all times. Only then you can walk into a SCIF with that watch. I do owe MW General Baptiste Jones a list of those devices for dissemination to the team. I will get that over to you because we spoke about it a couple weeks ago. For medical devices such as hearing aids, there are waivers that can be filled and processed. Again, you get those forms at the SSO. Here's an example of an electronic medical device request that you can get and fill out. There's a PWFD, I think that's a personal wearable, yeah, so watches. And then this is the form that I was talking about. So once you fill this out, this is the card, it's attached to the form, it's just on the second page. You're technically supposed to carry this with you at all times. I just leave mine in the office. Yes. Yeah, so a lot of these nuances, the SSO is your best bet to answer those questions. Yeah, so that's that for these. Let's go to the inductees' responsibilities. Yeah, so yeah, have a read through this. Essentially, this is like a lot of the stuff you guys already know. You all come from different backgrounds and different experience levels, but a lot of this applies in Canada as well as here. It's everyone's duty to report SCI incidents in a SCIF and to escort those without access rights who need to be in the SCIF for various reasons. They might have to be there for a meeting, but it's important that they be escorted. And SCI material has to be protected even after the indoctrination. Those of you who are indoctrinated, you've gone through the paperwork that you had to read and the criminal code excerpt that you had to read before you signed your indoctrination paperwork. I won't get into it here for the sake of time, but it's important that you realize SCI information, just because you're de-indoct, it doesn't mean the safeguards that were in place when you got indoctrinated remain exactly the same until the end of life. That's just how it goes with SCI information. So verifying access. So for those of you who are new and haven't gotten your badge yet, this is what the green access badge looks like. On the left is an example of a US personnel who works in the building, whether it's Shan Mountain or Building 2 or one of the other buildings. You'll see the pass in the middle for Canadian members, and you'll see the pass on the right for an approved visitor. So Major Foster mentioned VCRs, right? Hopefully you're all submitting VCRs your sponsor or whoever it is, or if you're the sponsor for someone visiting us here, hopefully you've done the paperwork 45 days ahead of time. When you do and everything goes well, they get the talk message and you as the sponsor go into the SSO office to pick up their visitor badges. That's what it looks like on the right. The numbers 1, 2, 3 denote the compartments of the SCI. So as a minimum, all the SCIFs here require 1, 2, 3. If you're missing one of them, you even if you're not a visitor, you probably need an escort, at least to some parts. So 1 is SI, 2 is TK, 3 is Gamma. And finally, so important takeaway, again, for all your COMCO and SCI inquiries, make sure you reach out to the positional mailbox. And this way, we just make sure that your query is captured and processed appropriately in a timely manner. I do have a team that I work with, and at different times, different people are monitoring the inbox and doing different things. So if you need COMCO assistance, the best way to ensure your assistance is responded to and taken care of is to go to the mailbox. Don't email any of us individually. And here we mentioned the SSO. Here's the contact information for the SSO. I can leave this up if you want to take notes. This specifically is the SSO office in Building 2, because a lot of you will be working out of Building 2, but chances are, I'm not sure for Shan Mountain, but you can contact these people to get Shan Mountain's contact info. Same SSO? Okay, so same office. Okay. So the SSO office is in Building 2. Once you get into the kind of the main foyer area, there is a main hallway on the right. Halfway down the hall on the left is the SSO's office. There's a doorbell, you ring, wait for the click, and you go in. That is all I have, pending any questions. Awesome. Thank you very much. Thanks for your time.
Awesome, thanks, sir. So now I'm gonna have the lovely and solver of all problems, Warren Colbrick, to talk about PSS. Come on up.
She misspoke. I'm not the solver of problems. Sergeant Noel is the solver of problems, but she's not here today, so you get me. Do I have a button? Oops. There we go. Okay, so we're going to talk about these few points. This isn't going to take a long time. If you need to stand up and shake it out, because I know you guys have been listening to PowerPoints and intricate information, if you want to take a second to shake it out. If not, we're going to proceed. Okay. So ARV forms. ARV forms are my bread and butter, and I've seen them work well and I've seen them work badly. ARV forms are your responsibility. I don't live in your house. I don't know who moved. I don't know that your cousins got divorced and you want to take one off. I don't know your situation at home. ARV forms are your responsibility. So once a year, we will get you guys to come in and do your ARV. Hint, hint, it's the month that you put in your utility claims. But if you don't come in and somebody has moved, you need to update your forms. When you got here, everybody should have updated their forms when they did their in-clearance in the orderly room. After that, your responsibility to make sure that these forms are accurate. So the next of kin form is the biggest one. If they are on your emergency contact and not on your next of kin form, we have no recourse to travel your family to anywhere. Okay, your next of kin form is where all the travel benefits are associated. You are allowed to have as many people as you want on that next of kin form, but it is the first 14 people that will be looked after. If number 7 can't travel or there's some reason that they can't go, then we'll go to number 15 on your next of kin list. So that means that everybody is marked in order of importance on that next of kin form. Okay. If there's any blank squares on your next of kin form, so you only want to put 5 and there's a whole bunch of other pages, you're going to put a diagonal line through and you're going to initial. That saves the family from thinking they ought to have thought that, or they ought to have meant to add me later. Okay. It covers off everybody's bases at the end. So your next of kin form, the first person listed has to be 18 years old. They are the decision maker. So if you get your spouse to be the primary next of kin. They decide everything. They decide who travels, how many days they can claim, yeah, that's pretty much it. They also decide any burial requirements or all those things. So these are conversations you need to have at home before you complete these forms. Now, if you have put your mother or your father as a primary next of kin and you know they're going to be a mess, maybe you choose an uncle that might be able to hold it together a little bit better in order to make all of the decisions that need to happen. I know it's a bit of a somber topic, but it's very, very important that these are completed correctly. If the person that you put on your will or your SDB, if you need to change those or if they have moved, please make sure they're up to date. Those are money, okay? In the next of kin form, that is all money. So make sure those are completed accurately and kept up to date at all times. I should say it again. Please make sure they're up to date and accurate at all times, okay? Yep, that's it. Post-travel allowance. Everybody wants free money to go on vacation, right? How many people have gotten their PTA before they came? Or before, like, since they've been here? Who has not gotten their PTA? Why? Okay, so make sure you go get your PTA. The policies have changed a little bit. Once you elected your PTA, you couldn't change the household size. So if you had another babes, you couldn't add them. However, if you do have a babes once you've been here, if your TED, your tour end date, is not still a total of 3 years, then you can't add that extra next of kin person or for the next of kin post travel allowance. So you can claim meals either per diem or with receipts. You can claim your travel. So if you go on a train, if you want to go on an airplane, if you want to drive a lot, keep the receipts for your fuel and or your airline ticket. Make sure it's not the quote. Make sure it's the finalized bill for the flight, not just the quote. Entrance ticket. So the purpose of the PTA is for you to go and see things that you can't go see in Canada, right? So go to the museums, go to the zoo, go to Denver and go have a really fancy pantsy meal on the King's Dime, like whatever you want to do. Bring those receipts back. So you have to provide proof of 75% of the money that you received. 75%, pretty easy, right? You do not need to spend the full 100%. Once you get to 75%, finalize your PTA claim. Do not wait until the year that you're leaving because it's so busy. It becomes a nightmare and you probably lost half your receipts by then. So finalize your claim as soon as you spent the money. And it doesn't have to be 20 trips. It can be one. Like I finalized mine in one trip. That's all it took. It goes quicker than you think. So all your references are in the MFSIs. So it's the CBI Chapter 10 for what you can claim. Now, do not submit claims to me that are just meals at the per diem rate for the whole thing, because that's not the intent of the policy. The intent of the policy is to have traveled and gone and seen things. So there should have been a gas receipt to get somewhere or a plane ticket or a hotel receipt, something, okay? 50 kilometers. So you can go to Denver for the weekend and claim it. Just saying, okay? Any questions on PTA? Yes. Doesn't matter. 50 kilometers from here. Yes, ma'am. No. So if your spouse is here and not working, they can go on their own. They don't have to hang out with you all the time. So if they want to go away and go on a trip without you, they can absolutely go do that and claim that as their portion. Any other questions? You're welcome. Okay, HLTA. How many single members are here? Okay, for HLTA, if you want a trip home at Christmas, you have to ask before you go. Okay, so you need to provide a quote for your flight, and you need to and put it. We basically put together a quote for you. We send it up the chain of command. We get the approval. Don't wait until the day before you want to go to ask permission to go on an HLTA, please. So basically, third location must be 800 kilometers from must be 800 kilometers or more from the member's post. So from here, more than 800 kilometers in order to choose a third location. So don't like have your family fly into Denver and then try and claim a third location, okay? For the third locations, there's an annual max rate. We can pull that and we'll advise you when you do put in your request for your HLTAs. Reverse next to kin, bring your fam jam here. Okay, let them go tour around and do all the things. You can absolutely do that. And again, we'll brief you on the entitlements for your HLTA once it's been approved, because everything changes all the time. Okay, any other questions? Compassionate. If you put in compassionate leave, you are not automatically entitled to compassionate travel. Compassionate travel needs to go through your chain of command to RCO for approval prior to you leaving. I understand that some circumstances are very last minute and you got to get out the door, but the chain of command is really quick at getting these processed and approved, okay? Once you get the approval, we will again brief you on your entitlements and what you will need to bring back to us for proof of travel and the proof of illness or whatever that looks like, depending on the circumstance. And again, each CTA, it's a different circumstance. So if somebody told you, oh, well, my brother's cousin passed away and I got CTA and whatever, don't ignore the rumor mill, come direct to the source for the information. It's going to save you a lot of money in the long run in case you are being misinformed by somebody, not the PSS orderly room. Okay. Yes. So compassionate leave, it's reckoned in calendar days, not working days. Okay. So it's the same as sick leave. So if you are going over a long weekend and all those fun things, you lose your long weekend, like you lose the stat holiday, it from start to end of your compassionate leave, it is compassionate. There's no weekends, holidays, any of that stuff. Okay. Any questions on CTA? I know I'm going pretty fast and furious, but no. Allowance and dedications apparently instead of deductions. So the FSP points, the base level points, they're on the next slide, so we'll talk about those. Post living allowance is tied to the location and your FSP, so the pay system does it automatically. The orderly room does not have to math, so we didn't do it wrong. PSA is 80% of an unrestricted full economy airfare for return travel from the employee's post to the headquarters city in Ottawa. So PSA, you'll see on your pay, like every once in a while, it'll drop like a little bit. You'll see a weird deduction. That is the PSA. Okay. Posting allowance, so sorry, you all got posted in before the big money drop next year, which doesn't come into effect until April 2026. Okay. So your posting allowance, of course, everybody should have gotten that. Did nobody get that? Did everybody get that? No issues. And then your rent and utility shares. So your rent and utility shares will remain the same whether you are promoted or not while you are here, unless you need to do a local move. If you have to do a local move, then they will go up to the new salary band under which you're being paid. Okay. The utility share, that piece might change if your household size changes while you're here. Okay. One thing on FSP I want to tell you. So you're responsible to self-report if anybody or in your family is departing for more than 26 days from this location. Okay. So if your wife wants to go back to Canada to go visit family for a month, we need to know prior to the 26th day because you'll lose one dependent level on your FSP until they are back, but it doesn't start until the 26th day. So if they're only gone for 30, you're only losing 4 days, but you are responsible to self-report. So please make sure that you are communicating with your HRA in those instances. Okay. Ready for the money? Money. So FSP entitlement. So the FSP, it's based on how many points you've gotten. Ops FSP do not intermingle with FSP. So if you went to Afghanistan 3 times, you don't get extra points here. Okay. You also, so it's based on you get your flat rate, and then depending on how many dependents you have, you get a little bit more money to make up for the difference. Okay. This changes every year. 1 April every year, we get a new rate. Okay. And again, the pay system maths for us, so it's right. You get 1 point per month that you are here for 10 days, unless the 10th day is the 31st of the month. So if you got here on the 22nd, you wouldn't get a point for that month because the 31st doesn't count towards the 10 days for a point. Okay. So you have to be here 10 days per month in order to gain a point. You get 1 point per month, and then that's how you move up on the board. Okay. Okay. Here's the people that make all the magic happen. Ignore my name and call everybody underneath. So, casualty admin, if there's an emergency on the weekend, please call my cell phone. Always call my cell phone. And then for compassionate, you can call either phone, but those are the main contacts. When it comes to sending emails, don't email your HRA directly, because if they're on course, if they're out of the office, then you are delaying your own responses. So please email the plus. Is that on here? It was there. Anyway, so we have it's a plus CFSUCS PSSOR mailbox. It's on the SharePoint page as well. Please always email the plus box before you email somebody directly, because again, you're going to delay your own responses. If somebody's not there for an appointment or whatever, we just dist it out amongst who's actually there at the time. Okay. So those are your HRAs. And again, you have alphabet groups. So that's the name of your HRA, just so you know. And there's some links for you. Not that you can click them off the screen, but they do exist. So there's the MFSI's, the CBI's Chapter 10. It's magic. It has every policy, and then it'll tell you which foreign service directive that we use, because we also use foreign service directives. So yeah, say foreign service directive. So everything is right there and ready to rock for you if you have any questions. Again, we're in the books every day, all day. So if there's a question that you're not quite sure or you want clarified, we can absolutely respond to you. So general information, there's a plus box. I knew I put it in there. So that's our plus box. Please email that before you email any of us. Don't hesitate to follow up on items. So you see, this is just the people that arrived this year. We have all of the debts, and we also have all the people that were here before you. So if you haven't heard back in like 3-4 days, even if it's we're on it, and like, just please reach out to us. We're here to help you. We don't purposefully, delay our response on something, and sometimes squirrels happen and something bigger showed up. So always feel free to follow up. If you see stuff that's weird on your MPRR or anything like that, please give us a call. The longer you wait for us to be able to correct this, the harder it is for me to get the data together to do the corrections. Okay. But if it's been like 15 years, it might take us a couple months. You know what I mean? Like, if you couldn't get it done by your old units, it takes us time too. Okay. So that is basically follow up with us. Keep comms with us. If you have questions, please ask them first. It's a lot easier for us to steer you down the right path instead of like maybe you spent money on something you weren't entitled to or whatever. It's a lot easier for us to clear it up before you make a boo-boo that costs money or anything to that effect. Okay. One other thing on the PTA, so the post-travel allowance, free vacation money, please make sure that your leave pass has the address that you're going to on the PTA. There's 2 reasons for this. One, if you don't put the address to where you're traveling to on your leave pass and it gets canceled for military reason, I have no recourse to even put in a claim to reimburse you, because as far as that leave pass was concerned, you're in local area. And then 2, it's really hard to finalize a PTA if it doesn't say you ever went anywhere on your leave passes. Make sense? Just saying. And so it's a good cover for you all. Make sure it's a lot more common than you think that people don't update the addresses. So please make sure you do that. And even if you're going to Denver for the weekend, put in a leave pass. Like if you've booked like tickets to a show and hotels that are non-refundable or anything like that, if you don't have a leave pass in, there's no recourse to reimburse you if you get canceled for military reasons. Just saying. Anyway, any questions about PSS admin orderly room stuff? Okay. Yes, sir. Yes. Mm-hmm. Okay, so for the Memorial Cross, next of kin, and ECN, and your family care plan, you can pull all of those out of monitor mass under your forms. Okay, Though you update those, you can scan or save them as a PDF. You can e-sign them, save them as a PDF, and then send them to your administrator. We only have 1+ on our mailbox, so you can't encrypt things and send them. So next to kin forms will have to be sent directly to your HRA. The will and the SDB, we actually, Corporal Gagne, you come up here and talk about the new way the SDB is going. Viens-t'en. On va dire une histoire. Si vous avez des questions en français aussi, on peut vous aider. SDB, go.
There is now a new way to do your SDB update through your pension portal. Sometimes it can be a little bit finicky to get on there, but if you switch from Chrome or Edge with your PKI in, it should work. If it doesn't work right away, wait a little bit, try the next day. But most of the time it works, and we just need a copy where you can save PDF the change you made, and you just send it to us.
Okay. Yay! That's why I said I'm not in charge. They know more stuff than I do. Okay. Any other, and the will, you'll have to come in and see us. No. Denied. Anyway, does anybody have any other questions about anything that we've covered today? I know it was a little fast. No questions. So if you go in the welcome book, there's a whole lot of information in there that I skimmed over very quickly, but there's a lot of information in there. So read through. It might save you with exporting your car and changing your driver's license and all the things that you need to do. Okay. Anyway, thank you.
Awesome. Thanks, Michelle. So the last presentation of the day is the Padre, and I do believe he is online. Sir, could you give us a heads up that you're there?
Yes, I'm here. Can you hear me? So, well, greetings, everyone. My name is Padre Gerson Flor. I have been here in Colorado Springs since August 2024, so for just over a year now. Unfortunately, I cannot be with you in person because I am on temporary duty in Halifax for a chaplain leadership conference. We are going to go through these slides. I know that the very first slide already has an incorrect date. My apologies. I updated the slide, so the information is current. I just forgot to update the most obvious thing, which is the date. Very good. So please, next slide. Very good. So the first question people may ask is, what do padres do, right? What is the function of padres in the Canadian Forces? And well, military members will have had contact with padres, with chaplains, and will be very familiar with what we do. But dependents may not know much of this. So in any case, it's always good to revise what is the chaplain doing here, other than enjoying the beautiful mountains and weather of Colorado Springs. So basically, chaplains are called to serve everyone in the Canadian Forces, in the Department of National Defense, and their families. So we are the caring face of the congregation. I'm sorry. We are the caring face of the organization. And we connect people to people and services that may help them when they need support. So basically, our primary function is to provide spiritual care and non-judgmental, confidential, and compassionate support to military members and their families. So this is important for people to know. Sometimes, we just don't know where to go for help. Who can we talk to? There's things that we may fear will have an impact either on our work relationships or on our career or on our families. And we should know that if we don't know where to start to look for help, well, a chaplain is here to be just that, a pair of ears who will listen to you no matter what your concern is, who will not judge you, and who will keep in confidentiality anything that you bring forward. The only situations in which chaplains have a duty to report are when someone's life is in harm's way. So if there's a risk for someone to be harmed, including the person who is seeing the chaplain, or when there's abuse against children involved. So in those cases, nothing is we cannot promise confidentiality. We'll ensure the person gets help or gets the protection needed. But in any other case, if you're having issues at home, at work, in the community, and you want someone to talk to, here's your chaplain available for you. Now, we also, of course, advise the chain of command on any matters related to the morale and well-being of the contingent. It is a commanding officer's responsibility, actually, to provide spiritual support and to care for the troops. So the chaplain is here an expert advisor in those things. So very often the chain of command will try to involve the chaplain if someone needs help, and maybe someone who has the time and the access to resources necessary, the chaplain may be implied. So don't be afraid to speak to a chaplain. No one will make you see a chaplain because you need to be converted or repent. We can have that conversation if you want, but when people are referred to a chaplain, it's usually because they need someone who can listen to them and help them find resources to overcome their challenges. So finally, we're here to promote spiritual, moral, and ethical values, which is something very much needed, especially in our day and age. It's important for people to remember that what we do, how we live, has a meaning to us and to others, right? So to help people when they need to reconnect to whatever makes their lives meaningful, it's an important contribution that we as chaplains try to bring to the organization. You're not just numbers, you're not just bodies on a war-fighting machine. You are human beings, and we're here to help your spirit to be strong and to be ready. Finally, we also officiate at services, ceremonies, commemorations, like we had the Battle of Britain recently. Sometimes people ask the chaplain, hey, Padre, I'm retiring, or I'm being promoted, or there's this situation in the family, can you come and say a few words? So we're here to provide that as well. Moi, je suis bilingue. C'est vrai, mon français a toujours besoin d'un petit peu de pratique. Donc, pour tous les membres et les familles francophones, je vous invite à m'adresser dans la langue officielle de votre choix. Moi, je suis toujours à votre disposition 24 heures sur 7. So our plan of action here in terms of chaplain support is basically I am located on Building 2 at Peterson Base in the Religious Affairs Office. For those who work in the building, if you know where the canteen is and where the barber shop is, the chaplain's office is right in front of the barber shop. So if you're coming that way. Or there's also a washroom right beside the barber shop. Sometimes if you need to make a pit stop, you may also come and stop and say hi. We'll be happy to talk to you. So most of my time is, of course, spent here in Colorado Springs. But I also try to visit all the detachments of our Canadian element NORAD once a year at least, and to maintain periodic contact with all the chains of command, regular training and maintenance of the Sentinel network. We'll talk more about that in the next slide. And being 24/7 available to all our members and their families. All right. So especially, I would remind members, if you need any help in the family, okay, don't hesitate to refer them to me or to our chaplain's office. So Canadian military members will be familiar with the Sentinel program, probably. We have a good number of Sentinels here in Colorado Springs. I know some of you who just arrived have been active Sentinels in previous units. I spoke to a couple of you already. So I will be reaching out to all the newly arrived who are trained Sentinels to establish your desire to serve as active Sentinels here in our command. The next training for those who have never received the Sentinel training or who want to refresh their training because they've been trained, let's say, more than 4 years ago. The next training is scheduled for the 16th of October at Building 2. So Sentinels, for those who don't know, are basically peer support helpers. These are trained, volunteer, supervised non-professionals who help to improve peer support on a daily basis in the workplace by a set of behaviors and attitudes. So we basically, this is a lot of words to say, we train people to be more intentional in watching for signs of distress in their coworkers. So because even the chaplain cannot be everywhere, our colleagues are always working side by side with us, and someone who works with us every day will be well positioned to see, well, whether I'm still doing well after I came back from a trip or after the holidays, or something seems to be off. So we train people to have active listening, good communication skills, to engage in conversations, to help people know that people care for them and that there is help around them. So for those who want to be active Sentinels, please reach out to me or talk to one of the Sentinels who works next to you, who will be able to direct you to how to register to the next training. The bottom line here is this, that as chaplains, next slide, please. So the bottom line for chaplains everywhere in the Canadian Forces is this: we care for all, right? Especially in OUTCAN positions, people may feel lonely, they may feel displaced, they may struggle to fit in with the culture. I have 6 years, now 7 years of experience in OUTCAN organizations. So I know from supporting people and from going through the experience myself with my family, how challenging it can be. We have highs and lows. We have a honeymoon phase where everything is beautiful, the mountains, the snow, the hiking. And then there's times when everything seems to be just uphill. So if you find yourself or someone you know finds him or herself in such a situation, needing a little encouragement or support, Please remember your Padre. He is here not on vacation for 3 years, but to work. And it is what brings me to work every day, is to be able to help people when they need, even if it's just listening and sharing the burdens they carry, and helping them find resources within themselves, within their network of relationships, or in the community, to overcome all the challenges, so that the military members can serve and be joyful as they do it. So here is my contact information for anyone who is trying to reach me. The first phone number there is my office number. As you know, I cannot have a cell phone inside the building. So my cell phone, which is at the bottom, is good for any time after work hours. During work hours, the top number, but even then, I don't always sit on my desk. I walk around the building, around the base. So if you cannot reach me by any of those numbers, send me an email and I will find you at my first opportunity. So this is my briefing. I hope it was not too long. If anyone has any questions, I would be glad to answer them.
Is there any questions in the room for the Padre? I don't see any hands. Padre, thank you so much for your presentation. Much appreciated.
Thank you, and welcome to Colorado Springs, everyone.
Thanks everyone for attending today. I just have a few closing points before we all head out of here. First, the Welcome Book Update Think Tank. I'm just going to revisit that. I know we've talked about it already today, but it's super important to us to get your input on how we can best support you. So please present yourselves to myself or Michelle at the back. If you don't want to present yourself here, please send us an email and we'll coordinate that with you guys. Next, I think you touched on it earlier, sir, AAR survey. So we want to hear from you how you thought today went, what we can do better, what things were good, what things were bad. If there's things that we didn't present on today that you think would be a beneficial topic, I will promulgate that out. Please fill it out. Let us know what you think. We really want to know. We already made adjustments this year. The start time was one of those. One of the biggest things we got feedback from was we started at 8 and it was too early for families to come because they couldn't drop their kids off at school or daycare or what have you. So no, we don't know those things unless you tell us. So please fill that out. A shameless plug for the Chief of Staff, the ND Town Hall, it's happening on Thursday at 2 o'clock. And following that is a TGIT, and you can do all the duty-free things and everything else. So Town Hall is mandatory, but please come to the TGIT also. Second to last, is there any more questions that you've held on to, the burning a hole in your pocket? The CO and myself and our teams are here to answer those questions for you. And if you don't, please just send us an email. But open the floor to any questions. Online, if you have any questions too, please don't hesitate to speak up. All right. So thank you again for coming. That's all we have.